Bore da. Pleser unwaith eto ydy croesawu pob un ohonoch chi i'n cyfarfod heddiw, sef cyfarfod bwrdd iechyd addysgu Powys. Ac fel dyn ni gyd yn gwybod, mae'r cyfarfod heddiw yn cael ei gynnal yn rhithiwr. Hefyd, mae'n cael ei ffrydio yn fyw ar wefan y bwrdd iechyd, ac yn ôl ein harfer, mi fydd na recordiad o'r cyfarfod heddiw ar gael i'w wylio yn dilyn y digwyddiad heddiw. Cal Cooper ydw i, sef cadeirydd bwrdd iechyd addysgu Powys, ac fe welwch chi yn y man restr ar eich sgrin o'r cydweithwyr sydd yn bresennol yn ein cyfarfod a'r rhai fydd yn cyfrannu at ein trafodaethau yn ystod y cyfarfod. Yn ogystal â restr o enwau cydweithwyr sy'n methu bod gyda ni heddiw ac sydd wedi cyfleu eu hymddiheuriadau am absenoldeb. It's a great pleasure once again to welcome each and every one of you to this meeting of Powys Teaching Health Board. As you can see, we are holding this meeting virtually. It's being live streamed through our website, and a recording, as always, of the meeting will be available for people to watch from our website following today. I'm Carl Cooper. I am the chair of Powys Teaching Health Board, and on your screen in a second or two, you will see a list of names of colleagues that are present in the meeting and that will be contributing to today's discussions and conversations, as well as a list of names of colleagues that can't be with us today and whose apologies for absence have been accepted. Just a brief word about us as a board. Ein pwrpas ni fel bwrdd ydy I fod y corff llywodraethol dros y sefydliad. Ac dyn ni yn gyfrifol am bennu cyfeiriad strategol ar gyfer y sefydliad. Dyn ni'n gyfrifol hefyd am osod archwaith risg wrth gyflawni ein nodau strategol, ac hefyd am fonitro cyflawniad a pherfformiad yn erbyn ein nodau strategol. Ac yn ola, ac yn bwysig iawn, yn gyfrifol am osod a lliwio naws a diwylliant y sefydliad. We have a number of responsibilities as a board, but if you like, our main responsibilities are to set the strategic direction for the organisation, to set the risk appetite in the delivery of our strategic aims, importantly, to monitor the performance of our organisation against those strategic aims, and last but certainly not least, to set the tone and culture of our organisation in line with the values base of Powys Teaching Health Board. You may notice that as we go through the meeting, some of us look away slightly from our cameras. I just want to give public assurance that that's not because we have lost focus or that we've lost concentration, just because a number of us will be working off a number of different screens, and occasionally we will want to glance to our left or to our right to access papers and other information. Ac mae'r bwrdd yn gyfarfod cyhoeddus yn unol a rheoliadau y Gwasanaeth Iechyd yng Nghymru, ond mae'n bwysig jyst I esbonio mai nid cyfarfod cyhoeddus felly ydy hwn. Felly yr unig bobl fydd yn cyfrannu at y cyfarfod ydy aelodau o'r bwrdd a'r rhai sydd wedi penodi I fod yn aelodau o'r bwrdd. So just a word of explanation that our meeting is held in public in line with NHS Wales regulations, but the distinction is that this isn't a public meeting. And so the people that will contribute to our meeting today are members of the board. However, we take seriously our responsibility in relation to engaging with our population, with our patients, with our communities, with our staff, and so on. And so we do invite questions and feedback from the public through various means. And as we go through our agenda today, we do have a question from a member of the public that will be dealt with. And if you'd like to know how to submit a question, then more information about that is available on our website. And just before we move into the substance of our agenda, I just want to note, as all of us are aware, that during October, our organisation was placed into targeted intervention. This is a higher level of escalation by Welsh Government, and that was for the domain of finance, strategy and planning. And our escalation status is as a result of our deficit in our budget and our end of year forecast. And that's due to ongoing system demand, workforce pressures and other cost pressures. And what it means essentially is that currently we are unable to deliver a financially balanced position with an in-year deficit plan of £23 million. I think it's important to point out that there are 6 domains of escalation, and for the 5 other domains, our organisation remains in routine monitoring, which is the lowest form, in effect, not escalated at all. But also, that doesn't mean to say that we don't take very seriously this heightened escalation. And it remains a significant concern to us as a board, and we are aiming to balance the delivery of our plans and meeting our statutory responsibilities for providing high quality healthcare for our population with the reality of rising costs and operational challenges across all of our services and all of our estate. And as we go through our meeting today, we will be spending some time discussing these issues and our response to that escalation status. But without any further ado, symudwn ni ymlaen rwan at yr agenda, ac fel arfer, mae'r agenda ac mae'r papurau ar gyfer y cyfarfod hwn ar gael ar ein gwefan. The agenda and papers for today's meeting are available on our website for people to access. And we've already dealt with our welcome and apologies, so we go now directly to declarations of interest. Oes na unrhyw ddatganiadau o fuddiannau mae rhywun eisiau cyhoeddi heddiw? Are there any declarations of interest that anyone would like to declare? I can't see that anyone is indicating, so I'll take it that there are no additional declarations of interest to those already declared on our register of interests. We turn to item 1.4 on our agenda, and it's a great pleasure today to welcome Shanti Momberg, one of our internationally educated nurses. Shanti will be introduced to us by Deb, our Executive Director of People and Culture. And Shanti, we're really looking forward to listening to you and to learning from you today as you share your story with us. But let's go firstly to Deb. Thank you, Deb.
Diolch, bore da, welcome. Delighted that Shanti has been able to join us today and share her story with the Spawnings board. Just a little bit of background. In 2023, when Shanti's husband, a vet, secured a job in Mid Wales, they moved from South Africa to Llanidloes in Powys. Shanti is a qualified nurse and midwife, and in November last year, she joined one of our internationally educated nurses training programs. And since gaining her UK PIN, she has been working for Powys Teaching Health Board. She has recently changed roles and joined the Clinical Education Skills team, supporting the delivery of the OSCEs programme to our internationally educated nurse cohorts, of which her first cohort passed all of their exams on the first time, and that's a first for Powys, so very well done. I'll hand over to you, Shanti, now for you to kind of share with us your story and your journey. Thank you. You're on mute. See if we can
Hello,
hear
everyone. So my name is Shante Mornberg, and this is my story. I'm a qualified nurse and midwife from South Africa. I qualified in 2017. In July 2023, my husband and I embarked on a new adventure, moving to the quaint town of Llanidloes in Wales for his job as a veterinarian. The charm of the rolling hills and the friendly faces made us feel welcome, but I was eager to find my place in this new world. One day, while wandering through the town, I stumbled upon a small cottage hospital. My heart raced with excitement. I had been without a job since we arrived, and here was a potential opportunity. I felt a surge of determination. I was going to walk in and ask for a job. As I entered the hospital, I was greeted by warm smiles and friendly chatter. The staff were welcoming, and I felt an immediate connection. A few weeks later, I received an invitation for an interview, and I was filled with hope. However, my excitement took a twist when I learned about the OSCE exam that I needed to pass to practice here in the UK. I had two options: prepare on my own or join a training program for international nurses starting in November last year. I chose to wait for the training sessions, believing the support of others would help me succeed. When the training began, I was met by a wonderful clinical educator who made the entire experience feel welcoming. She turned what could have been a daunting process into a supportive learning environment. I poured my heart into the preparation, and with plenty of tears, stress, and late nights, I passed the OSCE. The moment I was cleared to work independently on the ward, I felt a surge of pride. With 7 years of experience as a nurse and a midwife, I thrived in my new role. My colleagues were incredibly supportive, treating me like part of the family from day one. During my first appraisal session, I expressed my passion for training and development, sharing my dream of becoming a clinical trainer for the OSCE program one day. Having recently navigated the process myself, I felt I could guide new international nurses who were walking the same path I just traveled. To my delight, an opportunity arose to shadow several clinical training sessions. I was in my element, reveling in the chance to help others grow in their skills. A few months ago, I learned about a position for a clinical skills training officer. I applied, pouring my passion into every word of my application. When I received the offer, I couldn't contain my joy. Now I stand at the threshold of a new chapter, ready to help other nurses navigate their journeys as international healthcare professionals. I'm deeply thankful to Powys Teaching Health Board for giving me this opportunity to spread my wings. Here in Llanidloes, I found not just a job, but a community, a purpose, and a chance to make a difference in the lives of others. This is just the beginning of my story, and I can't wait to see where it leads. Thank you.
Shante, thank you so much. There's lots. I'm going to withstand the temptation to jump in and offer a comment myself, because although we don't open these stories for discussion, I know that Claire Roche and probably Deb will want to come in and share some thoughts as well. So let's go to Claire Roche, please.
Hello, Bore da, good morning everybody. Claire Roach, Executive Director of Nursing. Shante, thank you so much for sharing your story with us. I think it is an example of the fact that our internationally educated nurses brings such a vibrant and rich diversity of both background and experience. And not only is it fantastic to see that you passed your OSCE and came into the health board to work with us, but that actually you use that experience to go into a role in the health board that will support our current and our future internationally educated nurses to be able to get through what is actually a very intense process. So thank you for sharing your story with us. Continue to develop in the health board. I'm sure you will, and I'm sure you will grow on to other things. So thank you very much.
Thank you.
Thank you. Deb, any comment from you, please?
Yeah, thank you. You've made my day, Shanti. Absolutely brilliant delivery. Your pride, your determination, and your passion is just palpable. And I think for others on this call, we've referred to internationally educated nurses, the cohorts, how important it is. You've just brought all of that to life, and I think it will help us when we're in kind of future boards or committees, just to remind ourselves of that story that you've shared with us. So I'm really grateful for you taking the time out. Thank you.
Thank you very much. Thank you.
Shanti, on behalf of the board, I just want to echo that. We talk a lot about the importance of staff recruitment, staff retention, staff well-being, and looking after our staff and so on. And you know, what's struck me was that when we think about infection, we often talk about preventing and controlling infection, don't we? Well, your enthusiasm today is infectious, and I don't want to prevent and control that, certainly. In fact, we want it to spread like wildfire, because and we're absolutely delighted that you're here alongside all of our other internationally educated colleagues, and because your contribution to our services and to our population is significant and much appreciated. Thank you very much.
Thank you. Thank you very much.
So I want to go now slightly back to item 1.3 and the board action log. And I'm going to invite Helen, our Director of Corporate Governance and Board Secretary, just to take us through this item. Thank you, Helen.
Diolch, Carl, bore da, all lovely to see everyone. So just on the action log then, to give you a summary, there is one action that's flagged at risk. That's because we're requesting the board to accept a date change from today's meeting through to January. Work has commenced, but not yet ready to report. There's then in the next section down one action that's on track and due to commence from January of 2025. And then in the bottom section, 3 are essentially complete or transferred, as you can see there. So happy to take any questions, Carl, but essentially recommending the acceptance of that report to the board with that one date change. Thank you.
Thank you, Helen. Robert, please come in.
Yes, Robert Lewis, independent member. As far as the first one, Helen, there, which is 2466, I just wondered, and I think we have mentioned this before, could this be linked to the existing commitment in our board plan to engage with patients and stakeholders on perception and experience of access? Because we're going to have to work with FLICE anyway. Thank you.
Absolutely, Robert. I think it's intrinsically linked to that, and some of that will come through board, some of that will come through our PPPH committee as well. So yeah, wholly agree.
Thank you, Robert. I can't see that anyone else wants to comment on the action log, and so thank you, Helen. We move now, as I mentioned earlier, we have one question that's come to us from a member of the public. I'll read the question out, and then once again, I'm going to invite Helen to respond to the question. So, how has the Health Board sought to communicate openly and transparently with residents in the Llanidloes area regarding the changes to admissions criteria for the palliative care suite at Llanidloes War Memorial Hospital? Helen, please.
Yeah, thank you again, Carl. And just to say, we will provide a copy of our answer that we're reading out today to the member of the public that's asked it, and we'll make sure that that's available to them. And again, as you said, just to thank members of the public for the questions. This is a really important part of our board meeting. So the answer, and with thanks to colleagues for supporting the development of the answer is our priority as a health board is to ensure the best possible care and experience for patients and their families receiving end-of-life care. Our modelling to date shows that no significant change to our current arrangements for end-of-life care will be needed in terms of admissions criteria. Patients who currently receive end-of-life care will continue to do so. Our standard operating procedures include working closely with our palliative care team, and the nature of palliative care also means we will continue to discuss and work closely with patients and their families to ensure they receive the most appropriate, high-quality care possible. And as I said, Carl, that will be in our records. We'll also make sure that that's sent directly to the person asked the question.
Thank you, Helen. And so item 1.6 on our agenda are the update reports from myself, the Vice Chair and the Chief Executive. We usually take these as read, as we do all of our papers. And so we'll go firstly to my report. I don't have any additional comments, but I'm happy to take questions or to enter into discussion about any aspect of the report, should anyone like to. Chris, please.
Yeah, thank you, Chair. Councillor Chris Walsh, independent member from the local authority. I welcome your report, Carl, in relation to the developing relationship with the local authority. I think that's encouraging. Going forward, we face a number of challenges. Some of them will be heard today as well. But I think it's that shared partnership and collaboration that is going to help us getting through some of those challenges. One of the points that you've got on your paper, and it was in relation to the board to cabinet discussion, is it mentions then a particular focus around the delayed discharges to hospital, and there was something there about a data dashboard, and I just wondered whether you could just elaborate a little bit more on that, because that's something I've not heard of in that format. So I was just trying to get a bit more clarification on that, please.
Yeah, thank you, Chris. I will perhaps invite David Farnsworth to come in, but as I said in my report, it was particularly encouraging to myself, to the leader of the council and other board and cabinet colleagues that were there, that one of the things that our two organisations has identified is the importance of, if you like, a bit of jargon is having one version of the truth. And so when it comes to data in relation to patient flow, it really doesn't help if there are different interpretations of what the data is and what the data is telling us. And so we and the council have then worked together on a system that is called DigiFlow, and it's brand new, but it's very early days. But I think it's very exciting. In fact, I've just asked for a demonstration of it so that at least we can see it in practice. But David, please come in.
Thank you, Chair. David Farnsworth, I'm the Assistant Director, Community Services, and covering for Elaine Lawton, the Executive Responsible. So just to confirm, and Carl's answered it very thoroughly, in that there are systems which obviously we all rely on for information. The Health Board has our information which tracks all of our patients and their movements, and of course what they're waiting for. As Carl said, one version of the truth is quite challenging, so our teams sit and work together on a daily basis to make sure we are all at a patient level in the same place. but the executives responsible for managing these priorities, that is for us, Elaine, and for the local authority, Nina, who is their director, they have agreed to bring together that high level information into one place, which the teams can share in a way that we are comfortable that when organisations are relying on reporting externally in terms of where we are, we can use the same information, and that draws the information from those systems that have already been referenced, including Digiflow.
Is that helpful, Chris?
Extremely, and I think it demonstrates that whole concept about partnership and collaborative working, which will have ultimately benefits for patient care, and that's encouraging. So thank you, Chair.
Thank you. I can't see that anyone else is wanting to comment on my report. So we'll move to the Vice Chair's report. Kirsty can't be with us today, and so this report is presented in her absence. But if there are any questions or comments, then I or someone else will try to respond to those. Does anyone want to contribute in response to Kirsty's report? No, so we thank Kirsty for that, and we move to Hayley, our Chief Executive's report, again taken as read. But Hayley, do you have any additional observations, comments you'd like to make?
Yeah, thank you, Chair, and good morning, everybody. Obviously, it was just mentioned earlier at the start by the Chair about the fact that our escalation status has been increased to targeted intervention for finance, strategy and planning. And clearly, there's a very challenging in-year situation for us to deliver financially, which we'll be discussing later, and also our need to submit a plan by the end of this financial year going into next year. I think the point that was raised earlier, that we are in routine arrangements for all other aspects of health board delivery, is very important, and also the broader context in NHS Wales that now 6 of the 7 health boards are currently at level 4 or above for at least one domain of performance and delivery. So what this means for us as a health board is we are currently waiting for the first formal meeting with Welsh Government regarding our targeted intervention level, but it will mean greater input, scrutiny and working alongside with Welsh Government to make sure that we continue to plan and deliver for our population with that very firm focus on quality, delivery and finance. And you'll see a little bit later on the agenda the discussions that we've got around the development of our plan for submission to Welsh Government by the end of March. So clearly we've also had in November our joint executive team meeting with Welsh Government, which is a key accountability meeting that took place twice a year. The frequency of that now will increase due to our intervention status increasing, but it was generally important to feed back that in the joint executive team we covered a large amount of business that the health board covers, all of the issues around how we're delivering against our accountability conditions, ministerial priorities and performance trajectories, and there was a very strong focus on winter resilience planning, NHS waiting times and also women's health and population health in the session that we held. So again, we'll cover some of that detail a little bit later. Just wanted to draw to the attention of the board the latest update from the Joint Commissioning Committee with regard to the development of the recommendation for a bespoke road-based enhanced and critical care service in rural, remote and coastal areas as part of the emergency medical retrieval and transfer service review. And there's further briefing in the paper included on that and the work that we're undertaking currently to respond to the letter before action that we've received with regard to the judicial review in relation to EMIRS. I wasn't going to pick up much more from the report other to say it is good that we've been able to secure some additional resources with grants targeted towards energy cost saving measures, and also the new X-ray equipment, which is good news. And finally, I did not want to skip over the fact that in terms of staff recognition, our teams and our staff are really helping us to put Powys on the map. So you'll see the details for the individuals presented in the report. Really proud of everyone, but also a very hot off the press, Catherine Davis won the Registered Nurse Learning Disability Award in the RCN Awards last week, and that wasn't included in the report because the report was circulated beforehand. So really positive to share the good news and progress and achievements of our staff. Thank you.
Thank you, Hayley. So colleagues, would anyone like to comment or contribute in response to Hayley's report? Steve, please.
Thanks, Hayley, and a very good report. Could I just pick up the good news regarding the additional funding for energy cost savings, and just given the sort of the timing of the announcements, can you just give some assurances that we will be able to spend that money in time through the I believe it's part of this year and into next financial year? Thank you.
Yeah, thank you. Yeah, really pleased that we've been able to secure the funding, and the Capital and Estates team have been doing substantial detailed work with Refit Cymru to make sure that we deliver against the programme and the timescales that we've got. So yes, I can give assurance that I've been given confidence that everything is on track in terms of delivery against that particular grant.
Okay, Steve?
Yes, but sorry, I should have introduced myself as Steve Elliott, Independent Member for Finance. Thank you.
That's fine. Thank you very much. Hayley, can I just ask, in terms of staff recognition, you absolutely and quite rightly highlighted the fantastic work that's done across the organisation every day, and it's good to see that recognised almost on a representative basis, isn't it? So when I think of the really good stuff that's going on, for example, in the Living Well service with the reduction of people not attending appointments and so on, to what extent is that good practice then mainstreamed across the organisation, and what are the barriers to that? You're on mute, Hayley.
Apologies, sorry, try not to do that again. It's really important that where certain teams have been, I guess, at the vanguard of establishing new ways of working, that we take that learning and apply it across the organisation. I think as part of the evaluation and testing that it's worked well, then we discuss that and we have an approach to where would we go with that learning next. Clearly, for us, and perhaps Claire Madsen may want to comment on this, there is something also about, there are sometimes barriers around capacity in being able to get some of these mechanisms fully rolled out across all teams, but clearly where it's worked well, the question is why not? And there's an expectation now, particularly nationally, of adopting good practice across a number of fields, not just the stuff that we test locally in Powys, but also things that have worked well across other health boards and rolling that out across Wales. So clearly, I think that will be one of the key issues we'll be looking at in terms of our improvement team moving forward, to make sure that that learning is applied more broadly across the organisation as we see these examples coming to light that are having positive impact.
Thank you. Claire Madsen, please.
Yeah, I agree with everything that Hayley said. Claire Madsen, Director of Therapies and Health Sciences and Digital. I think, you know, just attending the awards is really important because everyone gets to hear what everyone else is doing, and it's amazing how many people contact you after the awards to find out more information about what's been going on. So just attending the awards can create that network of learning. with the Powys Living Well service, you know, we have national meetings where we share what we're doing, but internally within Powys, we always make sure at our heads of service meetings that we share learning. So we don't want to ever reinvent the wheel and make everyone learn how to do things twice. So if we've created new documents or new policies or new standard operating procedures, we can just give those to other services and share them widely. So there are mechanisms in place both internally and much wider to ensure learning.
Thank you, Claire. That's really, really helpful. And exactly as you say, Hayley, you know, the Cabinet Secretary currently is very keen that we adopt the principle of adapt, adopt or justify. And you know, that's, I suppose that's as important for us internally as it is across Wales. So, but that's very reassuring and assuring to hear. Thank you. So nobody wants to come in response to Hayley's report. So thank you, Hayley. We turn to item 1.7 on our agenda, which is the various reports from our committees. And as I always explain, I think it's important to explain, the work of the board is not just what happens in these meetings. In fact, we spend a lot of time outside of these meetings in our subcommittees, in our board development days, in our getting out and about, and in various other ways. And our committees, if you like, are the workhorses of our governance, in that they do the detailed scrutiny of a lot of the papers and a lot of the information that comes to us. And so these reports, as sources of assurance for us as a board, are very, very significant. And the chairs of the committees also have a key role in being custodians of that source of assurance. We do have two or three chairs of those committees that for various reasons can't be with us today, and I'm very grateful to the vice chairs of the committees for standing in and presenting the reports today. But initially, I'm going to ask Helen, our Director of Corporate Governance, just to introduce the item, and particularly the escalated items that are there for our information and for discussion, and also, Helen, to explain a new way of reporting from the committees that's adopted a new style and a new methodology. So over to you, please.
Thank you very much, Carl. Yeah, so I'm really pleased to introduce this, and we've been evolving our approach to committee reporting. And as you say, there is so much depth and breadth of information covered across all of our committees. We want to make sure that we're capturing that and reporting that to the board in the most effective way. All board members and of course members of the public have access to all of those papers and minutes, so all of the detail is always there, and that's highlighted in the reports as well. So for two of our committees today, Delivery and Performance and the Patient Experience, Quality and Safety Committee, there's a slightly revised format for how we've presented the report, and it's what's called an AAA format. So essentially it's about alert, advise and assure. So they're categorised red, amber and green simply for ease of view. And essentially it's the same information that the board would have had in a previous format, but just categorised in a slightly different way. So hopefully that gives some immediate context for where the board needs to put further focus, or where they need to be advised, or indeed where they can take assurance because the committee has taken assurance on the board's behalf. We would really welcome any feedback on that, either today or outside of the meeting. Both of the chairs of those committees have obviously signed those reports off to come here today. We'll continue to mature them, and if the board are welcoming of the format, we will extend it then to the other committees ready for the January meeting and onwards. So, Carl, that's a little bit about the change, as it were. But paper 1.7 in the pack that you have, or page 22 of the full board pack, again, you'll be familiar with the board of receiving this. It essentially tells you which committees are reporting to you today that have met in the period since the last board meeting. And then on page 3 or 24 of the pack of that particular report, what you can then see essentially is a summary of the matters that have either been previously escalated or are currently escalated newly from each committee. And we've then, in the appendice, you'll see some of the further detail about where things have been reported in previous meetings. So we've essentially tried to separate for you what is the current position of each of those escalated or alerted items, and then you can see the history in the appendice should you wish to do so. The only real new thing to identify, and I won't steal any thunder of the colleague Simon presenting this from PECS, is that there is a difference insofar as neurodiversity services. That's been placed into local escalation by the Executive Committee, and that's been reported to both the Delivery and Performance Committee and our PECS Committee. But each committee chair will just expand on that a little bit. So I hope, Carl, that makes the report a little bit clearer and a little bit easier to understand and follow. And probably just the last thing to say from me, we will just reconsider our language. And I think often what we mean when we use the phrase escalate to the board, that doesn't necessarily mean that we are asking the board to take any action. What that often will mean is that we believe that it's a relevant issue for the whole board to be aware of. Because there is something happening locally, generally of something that is, providing some challenge in an area that the whole board should be aware of, and therefore it's escalated in that context. Not necessarily because the board needs to take action. And clearly, if that ever were the case, we would highlight that very definitively. So I hope that helps introduce, Carl.
Really helpful. Thank you very much, Helen. Just whilst people are perhaps indicating that they might want to come in, so just for clarity, Helen, the new way of reporting, or the proposed new way of reporting, the AAA approach, as you mentioned earlier, and the way it works with the table of escalated matters that you also referenced earlier. So anything that's in the alert section of a report will therefore be included in the table of escalation. Is that how it works?
Exactly right. Spot on.
Yeah, okay. I just wanted to kind of just to clarify that. So I'll pause slightly just in case anyone wants to come in response to both Helen's explanation and also in response to anything that's on the table of escalated matters. Please, Mick, do come in.
Thank you, Chair. Mick Genassi, independent member. Just wanted to comment on the new structure format for the committee reports. I really welcome it. I thought it was much easier to digest, really a lot easier to focus in on the key issues, and I would welcome that being extended. There is a significant volume of information in the papers that we receive, and being able to go to the things which are the most important is really helpful. Particularly be helpful if that was extended to the Executive Committee's reports, because they do contain a lot of information, some very significant developments in the period. So I, for one, am very supportive and would welcome it being extended. Thank you.
Thank you, Mick. Helen, do come back if you'd like to on anything, but.
Thank you, Carl. Really welcome the comment, Mick. Thank you. And unless there's any other feedback to the contrary, we will now expand that into the other committees and continue to develop and mature the way in which we do those reports. Thank you.
Yes, thank you. And so let's go to the first of our committee reports, which is the Audit, Risk and Assurance Committee, and to its chair, Robert. Thank you, Robert.
Thank you, Chair. I'll just pick out a few things from the 8th of October meeting. First of all, the internal audit reports, and just to mention that one of those, cleaning standards, which achieved reasonable assurance, has been referred for monitoring to another committee. We reviewed the cost-saving arrangements. Of course, things have moved on since then, and we also spent some time on the developing board assurance framework, particularly focusing on the strategic level risks and the board governance, and also the process and the ability of this system to allow us to conduct thematic reviews. And then finally, counter-fraud update. It's pleasing to notice that there is an increased emphasis on prevention now that staffing levels have been restored by our counter-fraud experts. Thank you, Chair.
Thank you. So does anyone want to ask a question, make a comment or contribute in response to the ARAC report? No, so thank you very much, Robert. We go to the Executive Committee report chaired by the Chief Executive, and so back to Hayley.
Thank you, thanks. And just building on Mick's earlier comments, really welcome the revised highlight reporting approach, but particularly for the Executive Committee. Clearly, one of the key issues that we've got is that we deal with a number of practical day-to-day management and operational matters in the organisation, and we're already setting out in the report the matters that go onward to committee or board as well. But clearly, what you'll see in some of these topics is similar than topics seen in the committee being escalated and reported up to the relevant committee. So I won't cover this in detail because there's a large amount of matters in this report. It covers 4 meetings that we've had, and clearly we've already referenced the introduction of our integrated quality and performance framework, both in relation to the escalation of neurodevelopmental services, and I know that will be picked up in a later report from the committee, and obviously to note out of all of the matters here the position around the de-escalation of mental health under the IQPF as well. Those are the 2 matters I wanted to particularly draw out from the report, but I'm happy to take any questions.
Thank you, Hayley. Are there any questions, any comments in response to the Executive Committee report? No? Okay, well, thank you very much, Hayley. So in Ronnie's absence today, we turn again to Robert, who is Vice Chair of our Delivery and Performance Committee. Thank you, Robert.
Thank you, Chair. Our meeting of the 22nd of October discussed the new targeted intervention status of the Health Board in respect of finance and planning. Also discussed the financial performance of the board, the integrated quality performance report for month 5, and the integrated plan progress report. And these items feature in our agenda today, with the qualification that the IQPR report has been updated to apply to month 6. As already been mentioned, the neurodevelopmental services for children have been placed into internal escalation, with diagnostic work continuing to be undertaken and monitored by the Patient Experience Quality and Safety Committee, and further updates will be incorporated into the Integrated Quality and Performance Report to DNP. The committee also received and reviewed the General Medical Services Commission report. The committee concluded that the framework is providing assurance to the Health Board in relation to GP contract management. Further work is needed to understand the fragility of the GP service. And lastly, the in-committee D&P received the cybersecurity and national digital program risks and noted the updates provided. Thank you.
Thank you, Robert. Once again, I pause to give an opportunity for any colleagues to come in with contributions in response to the D&P committee report. There are none, so we move on to the Patient Experience Quality and Safety Committee, chaired by Kirsty, the Vice Chair of our board, who I've already noted is unable to be with us today. And so again, grateful to Simon, the Vice Chair, for presenting this report. Over to you, Simon.
Thank you, Carl. Simon Wright, independent member. So the Patient Experience Quality and Safety Committee met on the 7th of November. As has already been noted in the Executive Committee report, we received a report with information around the de-escalation of mental health services, and we will continue to receive an assurance report on the implementation of the improvement plan to its February 25 meeting. On neurodiversity services, the committee had transferred from delivery and performance the escalated position and will continue to focus on quality in addition to performance, as has been noted by both the previous reports. We should also note that the previous identified items on the patient experience system, Civica, and infection prevention control continue to be closely monitored by the committee, and although there's nothing to report here or raise or escalate at this juncture. We also received, the first time PECS had received the patient-focused report around health and safety that took assurance from the Q1 and Q2 key health and safety metrics. The committee reviewed the annual assurance report for medical devices and point of care testing and accepted that report as an accurate overview of the service and took assurance that medical devices and point of care testing requirements have been fulfilled. The committee also received and took assurance that the clinical audit is progressing in year as planned. And finally, we received a patient story from physiotherapy team, which was really very well received. Happy to take any questions, Chair.
Appreciated, Simon. Thank you. Does anyone want to respond to the PECS report? Perhaps I could just make a comment and perhaps ask a question. The improvement in IPC, infection prevention and control, is clearly a very assuring and a very welcome source of information there. I just want to say that I was very pleased just a few days ago to spend a little time with members from the IPC team and came away certainly very encouraged as to how they are helping to further strengthen and improve things, and a bit like we heard from Shante earlier, just came away with a sense of their diligence, dedication and enthusiasm, and so I just wanted to kind of share that. My question really is about Civica and the People's Experience Framework. And forgive me, I wasn't able to attend the last meeting of PECS. So, Deb, I don't know whether you would have a comment. As you know, this is a measure that I, as chair, need to report on to the Cabinet Secretary. We have had difficulties in terms of having the capacity to roll out Civica in a way that we would like to. I just wanted to get a sense of, is the People's Experience Framework a source of hope? Is that going to help us to strengthen and to broaden our use of Civica in a way that we want to? Claire, please.
Yeah, thank you, Chair. So I can come in on this question. We had a really excellent discussion at the Patient Experience and Quality Committee on the People's Experience Framework. And just to share with colleagues, the People's Experience Framework is a nationally driven piece of work. So that is underway. We are expecting to see that finalised after Christmas into the springtime. And so we are working nationally alongside other peers from health boards to be able to influence that and ensure that we have a view within that. So that is going to be a national framework for all health boards and health organisations to align themselves to, and certainly will be a very positive driver. And then we also shared with the committee some local plans for how we could strengthen our capacity and capability within the organisation for being able to really drive engagement with patients, service users and families and communities. So in short, my answer, Carl, is yes, it certainly offers us an opportunity for a structured framework to be able to take this forward.
Thank you, Claire, and apologies for mixing up my executive director's leads on this item. So thank you for that. Mick, please.
Thank you, Chair. I just wanted to, I attended the committee as and for the first time as an observer, a participating observer, not being a member of the committee. I think the committee was really struck by the potential in the patient experience people's experience framework going forward. But recognise that there is a need to invest. I think Claire signalled that, but I think the committee was very firmly of the view that it's an area, despite the financial challenges and all the capacity issues that we face, that this is an area that needs to be invested in going forward. And we kind of, suggested this comes to the board at some future stage for a discussion about how that might happen.
Thank you, Mick. Really helpful. And as we saw earlier, it remains an escalated item for our awareness on that table of escalated matters. So thank you very much. Okay, I can't see anyone else wanting to come in. So we move to the report from our Planning, Partnership and Public Health Committee. And back to Robert. Thank you.
Thank you. The committee met on the 11th November, so we haven't got the more detailed report yet. So I'm just going to pick out a few things. First of all, the strategic change report, which I've mentioned before. This contains some good news from Robert Jones Agnes Hunt Hospital, where the capacity of that hospital is being considerably expanded, and also in Wye Valley, where a new diagnostic centre is being built. The draft maturity matrix and the winter plan were also scrutinised, and these form part of the Health Board's agenda today. So I'll say more about some of these items when you have the more detailed report next time. Thank you, Chair.
Thank you, Robert. Anyone want to respond to the PPPH committee report? No, so thank you for that. So finally, but certainly not least, we go to our Workforce and Culture Committee, and in the absence of its chair, Jennifer, Steve Elliott is going to present this report. Thank you, Steve.
Thank you, Chair. Yeah, just to clarify, I'm not a substantive member of the committee, but I was able to attend on the 3rd of October, so I have agreed to feedback on behalf of the Chair. There's a comprehensive report, so I wasn't going to cover all of it, but just to pick up a few items. We received the Workforce Performance Report. Vacancy levels remain a challenge, and there has been an increase in nurse vacancies over recent months. But we also heard about the latest cohort of internationally educated nurses have arrived, and obviously we had the excellent presentation earlier in the session today, and that there's a further 12 nurses have been recruited. Also, 2 doctors have been recruited following a recent trip to Kerala in India. And there is also a new cohort of 19 aspiring nurses which have started their programme. Turnover rate of staff has also continued to reduce, and we're below the average for Wales on that. We received a presentation on theme 2 of the Workforce Futures programme, which is part of the integrated plan on a great place to work. This highlighted work on nurse retention, speaking up safely, clinical leadership and assurance, and we took assurance from the update against delivery of the plan. We also considered in the meeting, which was on the 3rd of October, the proposed temporary changes from a workforce perspective ahead of the decision that the board took on the 10th of October to implement those changes. And finally, we also received a progress update on agile working, which is obviously a key enabler in making best use of our estate. Thank you.
Thank you, Steve. Does anyone want to respond to the Workforce and Culture Committee report? No. So I hesitate to ask another question myself, but I just want, in terms of Workforce Futures, again, I spent a really encouraging few hours, again, a few days ago, with some of the People and Culture team, and we talked a little bit about Workforce Futures, and it seems to be doing some fantastic and very impactful work. I'm very aware as well that it's heavily reliant on external and time-limited funding. And I just wondered to what extent this is a risk to the future of this work stream, and what, if anything, can be done to mitigate that risk. Is that Deb? Please come in, Deb.
It is, thank you. So yes, it is a risk. We work closely with partners to make sure that the priorities of the Workforce Futures team are aligned to the priorities of the organisations, but nonetheless, there is a significant number of members in that team that are tied to RPB funding. All of the funding streams, not just Workforce Futures, but Live Well, etc., have been asked to complete an evaluation of what it is that has been progressed, what it is that's part of the plan for next year, in order for the RPB to consider the in-year position, but also consider what it might choose to do by way of funding. And I think that meeting's at the beginning of December. So we've contributed to that, and hopefully we've been able to demonstrate the value in this work, particularly now as we get into delivery and we've moved from the design phase of it. We've seen in other places and at committee and at board the powerful work that we're doing with schools. That has grown from just 2 schools to 11 schools, a reach of now 6,000 students. So all of that hopefully is positive for future workforce options for us and for the individuals.
Absolutely, Deb. As I say, I came away really struck by the impact of the of that work stream. So thank you for that. Hayley, please come in.
Yeah, thank you. Just to build on Deb's point, I mean, clearly at a system level and regional partnership board, the shared workforce challenges we're finding across the whole system, be it the third sector, the independent sector, with our authority and ourselves, one of the key risks we've got is about how do we attract, recruit and train and educate our workforce. So I think the risk is low, in my opinion, because the strategic risk around the workforce supply issues that we've got in our county is such that to deprioritise this sort of work would not be sensible. So I think I wanted to give that broader context around, from a corporate risk management point of view, ourselves, but also at a system level, workforce still remains one of the key issues that we're dealing with that we have to address. So really pleased with the progress through both the Workforce Futures programme, but the Health and Care Academy, etc., towards that work. So my view is that this work will need to continue and probably build further into the future to deal with the matters at hand. Thanks.
Thank you, Hayley. So I can't see any other contributions in response to that committee report. So thank you, Steve. And that concludes item 1.7 on our agenda. Item 2 on our agenda actually draws our attention to item 5 on our agenda, which is the list of consent items. These items are identified as, if you like, routine items that aren't controversial in nature, and therefore we consider that they don't need discussion at this meeting. However, it is always possible for a colleague to suggest that we move an item that is currently listed under item 5 consent agenda to be a substantive item on our agenda, and therefore an item that we would discuss. If that doesn't happen, when we come to item 5, we will just take those items en bloc and either approve them or note them or support the recommendation without discussion. And so does anybody want to suggest that any of the items listed at item 5 of the agenda be put on the substantive agenda and therefore be subject to discussion? No? So item 5 remains as it is. Thank you. So we go to item 3.1 and we're back to Helen for her report as Director of Corporate Governance. Thank you, Helen.
Thank you, Carl. So a relatively brief report from me for today's board meeting, just to give you the key highlights. So we've tried to improve and make clear to the board, obviously, but more importantly, the members of the public around board activity that happens in between meetings. So just to confirm, there has been no in-committee meeting of the board since the last scheduled meeting on the 25th of September. We have, however, held an additional in-public board. All of the information is available on the website, and indeed members of the public were able to access that on the 10th of October. And as usual, we've held our normal board development sessions in November. Second area then is around the application of the common seal. So this is our legal and official seal of the health board. That's been applied once since this was last reported, and that's in relation to the allotments at Welshpool Hospital and how we share those with the town council. And then lastly, the register and declarations of interest. And Carl, with my apologies, there is a slight error in the report. It refers to the 23-4 register. It is the 24-5 register. It's this current financial year. So apologies about that, and we'll make sure that that's corrected. But just on terms of register of interest, as we saw at the beginning of this meeting and every other meeting the board and its committee hold, we do seek declarations of interest, and we often refer to those that have already been reported. And this register is where all of that is housed. All of that information is available on our website, and board members and other senior colleagues are almost constantly updating that register as things evolve and as things change and happen. The assuring committee is the Audit and Risk Assurance Committee. The report was received by that committee on the 8th of October, and they took assurance that we have the appropriate monitoring and reporting mechanisms in place. And as I said, that register is continuously available on our website for anybody to access at any time. So, Carl, apologies, it's quite a long recommendation in the paper in relation to that one, but that's the summary of my report. Thank you.
Thank you, Helen. Does anyone want to respond to Helen's report? No, so we go to the recommendation, and that's that we receive the director's report, we ratify the application of the common seal, applied just on one occasion since the 22nd of May. We receive assurance that the action was taken in accordance with section 9 of the standing orders, and we receive the register of interests for our board members as of the 22nd of November 2024. And finally, we take assurance that the Audit, Risk and Assurance Committee has taken its own assurance that the organisation has appropriate processes to support the collection, management and reporting of declarations of interest in line with the standards of behaviour policy. And so I'll take that recommendation as a composite recommendation. Would anyone like to indicate that they don't support the recommendation? In which case that's supported unanimously. And we turn our attention to the minutes of the previous meeting for approval. Are there any corrections or amendments that anyone would like to suggest? No, so we approve those minutes as a correct record. We've already dealt with earlier on our agenda the action log, but are there any other matters arising from that set of minutes that we haven't dealt with on the action log that anyone would like to raise? No, thank you. Which takes us very smoothly to item 3.3 and to the Compassionate Leadership Charter. Sorry, I think I've just been alerted to the fact that I have omitted to ratify a second set of minutes. So just for clarity, let me go back to that then. So minutes of previous meeting held on the 25th of September. Let me therefore clarify, are there any suggested corrections or amendments? And minutes of the 10th of October, any suggested corrections or amendments? There are none, and therefore we approve both of those sets of minutes as a correct record. Again, are there any matters arising that we haven't dealt with elsewhere? No. So apologies for skipping over the fact that we had 2 sets of minutes. We turn our attention to the Compassionate Leadership Charter. Compassionate leadership is something that has been around for a little while and is shaping the culture and the way that we operate within health organisations and within health services. And all health bodies are being asked to consider signing up formally to the Compassionate Leadership Charter, and therefore a kind of formal commitment to that set of principles. So I'll go to Deb, who's going to introduce this item. Thank you, Deb.
Thank you, Chair. We know that research shows that compassionate leadership has a wide range of benefits for both staff, organisations and those we care for. Staff who are treated with compassion are better able to direct their support and care given to others. We regularly report on the development and delivery of compassionate leadership through to Workforce and Culture Committee. We've been embedding compassionate leadership at a leadership level and management and team development level since 2021. The signing of the pledge, if that is endorsed today, is another demonstration of our commitment to displaying the right behaviour and values through all of our interactions. I'm hoping that colleagues today will recognise that some of this work has been rooted in the work that Michael West and others have done around compassionate leadership. I'm happy to take any questions. Thank you.
Thank you, Deb. Are there any questions or comments to Deb in terms of the charter and our signing the charter? Please come in, Chris.
Thank you, and thank you, Deb. I think that this really does underpin what we expect of our staff to do with patients, in the sense of giving compassion and consideration. And this actually now moves it up the chain that we give it back as well. And I think that reciprocal action is helpful, and it supports really the statement that you made, Carl, right at the beginning around the culture of our organisation. So this really underpins that on there. The question from me is, at what level is this leadership programme going to be offered to? Is that going to be to the clinicians, and is it going to be those ones that are aspiring to go into leadership moving forward?
Thank you, Chris. Sorry, if you hold on to the question, Deb, please, and I'll just invite Mick to come in, and perhaps you might like to respond to both. Thank you, Mick.
Thanks, Joe. It was a complimentary question, really. So I'd be hugely supportive of signing this. You know, my other role as Chair of Social Care Wales, you know, we are jointly with Health Education Improvement Wales responsible for the workforce strategy, and compassionate leadership is a golden thread which runs through that. So I'm really pleased to see compassionate leadership being rolled out and embedded within Powys, and we'd be very supportive. My question really was about, you know, following on from Chris's question about the level at which this is delivered, is about the board's leadership role. So I think we know that, you know, the leadership style and behaviours within organisations cascades down through an organisation, and it starts with the board. So the board's compassionate leadership of the organisation is really important. I just wondered if we're planning any work as a board, developmental work, around our role in reinforcing those behaviours.
Thank you, Mick. So I'll go to Deb, and I don't know whether Helen might like to come in on board development and so on, but please, Deb.
Thank you. So just to attend to Chris's questions first. So we offer leadership, I should say, at all levels, for mature leaders who want to brush up on skills, for new leaders who are getting acquainted, and for those who aspire to move into a leadership programme. leadership role. We also have reported through Workforce and Culture Committee the Clinical Leadership Immersive Programme, and we've also had a staff story around somebody's experience on that. So compassionate leadership is flooded through all of those development programmes. So at no point should anybody be accessing development at an individual team, management leadership. They won't have missed compassionate leadership and that opportunity to understand what it is and what it isn't. I think, you know, we need to help and reinforce the support to individuals, because for some that is a bit of a shift in terms of their natural stance. Back to Mick's point, we clearly run quite a few board development sessions. We've done quite a lot around our skills deployment, what we kind of display when we're kind of working with us, what we might display when we're in a conflict situation in terms of personal traits and our strengths. And I think this is worthy of a future return to that, particularly because we've got new board members around the table. So I think that's a really helpful suggestion. Thank you.
Thank you, Deb. So we go to Hayley and then to Helen, please.
Yeah, thank you. Really welcome this pledge, and I think particularly within the challenging context in which we work, how we do things matters as much as what we do in our day-to-day work. And I think some of the content of the report that sets out what we're already doing, it's just that reinforcement really. This is across all levels of the organisation. This is about every member of staff being aware of the tone and the culture and the values and behaviours that we are wanting to demonstrate on a daily basis. And I know that Deb and I have been having discussions as well. We often use the language of avoidable patient harm, and we've had discussions only in the last few days about avoidable employee harm when we're actually implementing and moving forward with sometimes very challenging situations. So I think, you know, really welcome this work, and also how we can perhaps, once we've looked at this at an organisational lens, bring it into the partnership RPB sort of workforce future space as well. So thank you, Deb.
Thank you. And Helen, please.
Yeah, thank you, Carl. I was just going to compliment really what colleagues have said. We'll absolutely be building this into the board development programme. The other thing that we've been considering and looking at is our colleagues in Health Education Inspectorate Wales, HEIW, have developed an online tool that we're looking at how we incorporate that into our committee effectiveness and board effectiveness reviews as well. So we can seek some feedback from both colleagues that join those meetings, but also attend those meetings as a way of assessment.
Thank you, Helen. So certainly seems that there is widespread, there's a widespread warm welcome to this item, and its importance for us as an organisation, as people, and as providers of service. So, so the recommendation is that we note the approach to and the progress in embedding compassionate leadership across Powys Teaching Health Board, and we approve the signing of the Compassionate Leadership Pledge. Once again, if you don't support that recommendation, please indicate. And that too is supported unanimously. Hayley and I will sign the pledge, and we'll use the signed pledge as one of the ways in which we promote this and draw awareness to it across the organisation. And also, as we have acknowledged, we recognise our role as a board in modelling and incarnating, if you like, the compassionate leadership principles, and we will be building that into our development sessions and so on into the future. So thank you so much. So we're running a little bit ahead of time, which is a good thing, because I think that perhaps one or two items later on our agenda will take perhaps more time than we've currently allocated. We'll see. But nonetheless, let's still take our 15-minute break, and therefore we reconvene at 11:05, please. Thank you. Croeso nôl. Hyfryd gweld chi unwaith eto, ac mi wnewn ni ailgychwyn y cyfarfod ar ôl yr egwyl. So we reconvene our meeting after the break and turn our attention to item 4.1 on our agenda, the temporary service change update. At the last meeting on the 10th of October, we approved a set of temporary service changes. We know that there is and continues to be considerable public interest in these changes, and we committed ourselves as a board to keeping a close eye on the implementation of the changes, their evaluation, and therefore what we learn from them and their impact and so on. And so really good to have this report on our meeting today. And over to you, Deb. Thank you.
Thank you. As you say, Chair, this report sets out the progress on the two temporary changes following the decision cases received and approved by board on the 10th of October. Work streams have continued to prepare for implementation, work with staff and their representatives, engage with stakeholders as necessary, and prepare for the operationalisation of the plans. In the case of the temporary closures of some MOUs overnight, this went live on the 18th of November, and page 3 of the report describes the actions implemented from the mitigation plan. At the Strategic Change Board meeting yesterday, it was reported that all was going well with no adverse or unforeseen issues arising. Teams are engaging positively, and we will keep under review whether any additional public communications are necessary over the coming weeks. In relation to the co-location approach for the ready-to-go home units and rehabilitation units, progress against the mitigation plans are set out on page 4 of the report. And whilst there is a further meeting this week to formally sign off standard operating procedures, there were no issues raised with the Strategic Change Programme Board yesterday. And on a go, no-go basis, from what is in place and what was heard, it was agreed that we should move to full implementation on the 2nd of December. Again, this will be closely monitored and escalation processes are in place should something unexpected occur. In terms of public communications, there is a digital leaflet already in circulation with printed literature and a video from Claire Roach just being finalised and we're expected to be published later this week. We described in the report on the 10th of October the approach on evaluation and monitoring of the temporary changes. I can confirm that baseline data has been captured, and this will be considered along with the criteria to inform future decision makings at the forthcoming Strategic Change Programme Board, and will be part of the update paper to board in January. It is fully recognised that we will need this forward plan for decision making based on data, benefits realisation and the criteria, and all of that will be included in January's report. There are a number of execs on the call today who are exec sponsors or SROs, and happy to bring those in for any points of detail or any clarity that might be required. And can I just put on record as well our thanks to Thlice and for staff side for their invaluable contributions during this kind of period of working up these proposals and getting ready for implementation. I'll pause there and take any questions. Thank you.
Thank you very much, Deb. Simon, please.
Thank you, Deb. It's really encouraging to have this report setting out how things are progressing since the decision was taken in October. So thank you for that. The area of question I had, I just recall some of the concerns that were raised with us about these changes were in relation to transport. So I just wanted to check whether those issues are being considered in terms of the mitigations work that's taking place, or have they been addressed in other ways?
They've been considered in the work streams with no issues being raised. I'm looking at nods on that. Yeah, that hasn't come up. So clearly the work stream has assessed any of the potential issues and is satisfied that it's resolved or not material.
Great. Thank you very much.
Chris.
Thank you again for the report, Deb. I think it's really helpful. I note that you've done some of the roster implementation from the 18th of November. I just wanted to see whether you're seeing a little bit more of a stable staffing situation, because obviously part of the considerations is that we had to close the units from time to time, which made it more unsafe. And I was just wondering whether that was appearing to be a bit more secure with less reliance on agency staff.
I wonder if I can ask David. I can see David's got his hand up. He'll have a more up-to-date position. Thanks, David.
Yeah, thank you, Deb, and thank you for the councillor for the question, councillor. Yeah, just to confirm, actually, we have had some benefits already in terms of stabilisation of the workforce. It's hard to say whether that's due to these changes and the greater availability of our staff during the day, or whether it's just happenstance. But certainly, we haven't had any closures unnecessarily in that time.
Thank you, and Mick, please.
Thanks, Chair. I appreciate that, these temporary changes primarily driven by quality, safety, patient experience concerns, but I noticed there's no reference in the evaluation criteria to monitoring the financial impact. So whilst, the ambition is for a safer, more effective model, we would hope that there was some financial benefits accruing from this, particularly from a reduction in delayed discharges and reduced length of hospital stay. So I just questioned why there was no financial evaluation included in the suite of measures.
We're still working on the suite of measures, Mick, and I know that financial monitoring and tracking will be an element within that. So we can expect to see that when we bring it through in the January report.
Thank you. I can see that Nicola wants to come in. Is it on this point, Nick, or?
Yes, Chair.
Yeah, please do.
Yes. So I'm Nicola Johnson, the Director of Planning, Commissioning and Performance. So I just wanted to pick that point up, that this report intersects with the finance report, which obviously is next, and with the winter plan report, which is on the agenda later. And Mick's point about the financial impact as well as the quality impact is really important. In terms of both our own provider services and our commissioned services, and the bed days used for older people in both of those elements of our services. So just wanted to point that out.
Thank you. And we'll go to Steve Elliott.
Yeah, thanks, Debs. I noticed in terms of the actions relating to co-location that staff are starting to work with families to inform them of the changes. So I'm just wondering, or just asking how those discussions are going, and also assurance that staff are supported when they need to have perhaps more difficult discussions with families in terms of the impact of the changes on their loved ones. Thanks.
Okay, I can see David's got his hand up. I'll come to you, David.
Yeah, no problem. So yes, both good points. Thanks, Stephen. In relation to the support, as well as our usual escalation of management. So we have senior managers who are actively supporting the wards at the moment and working with the flow team. It's fair to say that many of us as senior managers have a lot of experience of sitting with families and talking about some of these more difficult conversations. So it is working its way through those management team, and they get the support on a daily basis. In relation to whether we are experiencing those challenges, again, mixed. There are some families who are expressing some concerns around the impacts of that, but we obviously have those conversations and hopefully can assuage those concerns by demonstrating the benefits of these plans.
Thank you, David. Just a question from me, Deb, if I may. On page 3, mention of the MIUs. One of the things that came out of the public consultation and the public engagement was the relationship, if you like, between the 111 service and MIUs. And I've had some conversation recently with some of our MIU staff, and the observations were around kind of some clunkiness, really. So you mentioned the use of phone first, and and the fact that sometimes when people are referred from 111, they're not encouraged to phone first, and they simply turn up. And also perhaps people being sent to MIUs that really should have gone elsewhere. So my question really is, how confident are you that that working relationship between 111 and our MIUs is as smooth as it needs to be? And if it isn't, are we working with them on those issues?
I can see Kate's got a hand up, Chair, so I'll defer to Kate. Thanks.
Yeah, thank you, Chair. Kate Wright, Medical Director. Good morning, everybody. So it's really, really important. And one of the things we became very aware of during the engagement period was how critical it is that we have a clear understanding of this, what is a very complex system, to make sure our residents know where to go for help when they need it. So one of the things we'll be doing, we have been doing and will continue to do now, is to continue to loop through our mitigation to review whether the comms are right and whether we can make them better and as clear as possible. In terms of the interaction with 111, then again, that can be and is an iterative process, so we will continue the dialogue, and if we can see issues or things that we need to discuss or iron out, then we'll continue those conversations. So now is really, really important to learn from our staff, learn about, it's an opportunity really to really look to see where we can act or intervene to help people get to the right place the very first time. And so we continue the conversations. If there are things within the pathway that we need to correct, then we have the mechanisms to do that.
Thank you, Kate. So no one is indicating that they want to contribute further. Apologies. Katie, please do come in. Katie is the Regional Director for CLICE, and as Deb acknowledged earlier, that really important working relationship, particularly associated with the temporary changes. So do come in, Katie, please.
Thank you, Carl. Yeah, just to reiterate, I sit on that Strategic Change Programme Board as an observer. I'm not part of the decision-making process, but I'm able to participate in those discussions, which is hugely valuable. I think it might just be worth noting at this point that CLICE intends to visit the basis of the changes, so the hospitals and the MIU, in February, as part of our ongoing programme to listen to patient experiences, and which I would hope would feed into that sort of evaluation going forward. So just to alert you to that. I think the other thing that I just wanted to pick up, and I appreciate that Nina's not here today, so it may not be appropriate to have a broader discussion. But we have had a number of, we've had two instances where people have come to us concerned about having to go going to Llanidloes rather than going home. And by definition, the co-location of ready to go home does what it says on the tin. It's for individuals who are ready to go home. And I'm just wondering what discussions, and I think we in CLICE might facilitate a discussion between the health board and the local authority. What discussions are actually, what work is going on with the local authority, so that actually that sort of step to the ready to go home base could perhaps be sort of taken out of the loop with individuals going home straight away. So I think from a patient perspective, it's putting another step in. It's obviously a bit of a mitigation to the existing pressures on social care, which I fully appreciate. But at the end of the day, it's about the experience that the patient has. So I'd just be interested whether now, as I say, Nina's not here, or perhaps outside of this board meeting, to further interrogate that sort of aspect, really.
Thank you, Katie. I can see that Claire Roche and Claire Madsen are indicating that they want to come in, so I imagine it's in response to Katie's comments. So Claire Roche, would you like to come in first, please?
Yeah, thank you, Chair, and thank you, Katie. I think it's really important to assure the board that our colleagues in Powys County Council and indeed our colleagues in the third sector have been a key members of our co-location work stream. So that's really important to assure board of that. But equally, in terms of some of the practicalities, there are a number of things that are taking place. So in the first instance, we are expecting that assessments will be completed before patients actually come to the ready to go home units. And indeed, the flow teams are working as an integrated source. So this is an integrated resource between the health board, between the local authority and the third sector. Really ensuring that we're undertaking daily reviews of our patients and clearly adopting a person-centred approach. So, you know, we do want people to be in the right place with the right level of care, but equally we'll take a view on where that can be best provided. And I guess an example of that is the shared brokerage arrangement that we have as a health board with the local authority, which will hopefully help to minimise duplication, improve communication, but ultimately be able to be really focused on putting both the person and the family at the centre of decisions, but recognising that, of course, we want people to be having the right level of care in order to ensure that we can maximise people's recovery and their fitness, and ensuring that we really guard against any further deconditioning. So happy to have a further discussion offline, but I hope that provides a little bit of assurance to Katie about the arrangements that are in place.
Thank you. And Claire Madsen?
Yeah, thank you, Carl. Very much the same as Claire. I just wanted to say, you know, those processes are already in place. We have discussions and they do attend all of our meetings. So just an assurance there for Katie. And we do have a home first team and a home first approach. That is always our first approach that we want to take. It's not always possible, and for various reasons, not only our partners, but maybe other things that need to be sorted out. So, but we always look to home first before we look at anything else. So just a reassurance, Katie.
Thank you. And of course, these matters and this report has received detailed attention from our executive committee. And so, Hayley, as chair of that committee, would you like to come in and offer an observation or a comment?
Yeah, thank you. It was really on that point, which is that, you know, the Executive Committee is receiving the reports from the Strategic Change Programme Board regularly, and we did discuss this report en route to the board today. But also, you know, I know people are keen to see the impact and the evaluation of this work, and it's important that we bed down and get the model in place from next week now. And clearly, you know, how we bring back that evaluation information through to the board will be really important to demonstrate whether the benefits we are expecting this to realise actually materialise through the arrangements. And clearly the context is all important, and I appreciate we've got later items on winter planning and resilience, but clearly already it's been a very tough couple of weeks with adverse weather and flooding across NHS Wales and affecting our communities. So as we go into winter, you know, we'll get the evaluation of the change, but also the updated context on some of these changes will be really important for us to consider as they come back through the reporting cycle. Thank you.
Thank you, Hayley. So as we bring this item to a close, Deb, you mentioned earlier some work that's going on in terms of comms, and you mentioned leaflets and videos and so on. And I'm sure that board members would be interested in receiving copies for information and so on when they're available. So if they could be shared, that I think that would be helpful. Thank you. Do you have any closing comments, Deb, before we go to the recommendation?
I guess just to extend again the gratitude, not just to kind of FLICE and staff side, but to all of our teams, all of our members of staff who have worked with us, come up with kind of creative plans, tested the plans, and clearly the public and stakeholders for their comments along the way. This is an important set of changes for us from the quality perspective. And of course, we always are open to kind of reflecting and considering how we approach such matters in the future, particularly as we start to work up route map to sustainability consideration. So we will build on that. Thank you.
Thank you very much. So the recommendation is that we take assurance about the operational readiness to implement the temporary service changes to date. And we note that the temporary service changes continue to be progressed to full implementation under the oversight of the Strategic Change Programme Board, and further updates through to Executive Committee and to us as a board in our January and March meetings. Would anyone like to indicate that they don't support that recommendation? That too is supported unanimously. Thank you. So we come to item 4.2 on our agenda, the financial performance. It was mentioned earlier in relation to the position we are in terms of our finance and our escalation into targeted intervention. And so we have already acknowledged the risks to delivering the in-year deficit forecast of £23 million. And certainly as a board, we recognise that we'll either need to change our forecast or we'll need to take further action to reduce our costs in order to achieve the current forecast for the deficit forecast for our financial year. As a board, we have an in-committee meeting later today where we will have a further discussion in relation to the nature of these matters. That will be reported in public in our next reporting cycle, or indeed sooner if more immediate action is needed. But the reason that we're having an in-committee meeting is because of the sensitive and commercial nature of those discussions. But just with that brief introduction, I'm going to now invite Pete, our Deputy Chief Executive and Director of Finance, to introduce the financial performance report. Thank you, Pete.
Thank you, Carl. So you've probably covered some of the points I was going to make in my summary of the finance report. So the finance report is included in the board pack in the usual format. This is reporting against our month 7 position. So I'll give a couple of key highlight points and then we can open it up for discussion. And thank you, Carl, for referencing the in-committee discussion a bit later on today. So as of month 7, we continue to monitor our performance against our unsupported deficit plan of 23 million. We've been off profile against that plan for a number of months. We are seeing some impact from the actions that have been taken, but we still remain off profile against that £23 million deficit plan. As at month 7, with 3.8 million off profile. If we continue at that rate of expenditure to the end of the year, we would have a forecast variance against that plan of 6.5 million. That would be an adverse variance against the 23 million. As reported in all of our previous boards and committees, our key pressure areas continue to be commissioning, both in terms of elective and emergency activity, noting that some of that elective activity is a very positive news for the Powys population, but it does create financial pressure for us. Ongoing pressure in relation to CHC, again, as previously reported, this is both in terms of the number of cases, but also the acuity of those cases, which are needing higher level of care. Our ongoing spend in relation to agency, which we've touched on a number of times already within the board agenda today, and the ongoing pressure across all areas in relation to secondary care delays. That again has been touched on in the agenda. if you note on page 6 of the finance report, the total opportunity cost of those secondary care delays is £11.3 million to month 7. So the summary of that is that we need to take further urgent mitigating actions to enable us to hit our target deficit plan of 23 million. That's our target in terms of the deficit plan, and noting that the potential variances I've already highlighted. The other thing to flag is that there's a further issue, which is a financial consequence for us in terms of the anticipated level of funding we were expecting to receive in relation to the English pay award and the impact that has in terms of our commission services position with our English providers. As at month 7, now being informed that we're unlikely to be allocated any funding in this regard, and this will create an additional financial pressure of 3.5 million. So before opening up to any further comments, the summary is that we need to take further urgent action to mitigate these cost pressures, and that will be above the 9.9 million savings plan already included within our plan, noting that we're on track to deliver against that target. So it's a very significant challenging financial position. But I'll pause there and open up for any questions, comments or observations. Thank you, Carl.
You and Robert, please come in.
Yeah, well, once again, Pete, the delays in discharging, I mean, it's an enormous sum, isn't it, really? And it's quite devastating to our bottom line. So I'm very conscious of all the work that's been done behind the scenes and the discussions with the county council and so on. Really quite desperate to see some change and some shift in that next year. Can I just confirm with you, Pete, that assuming that on the extrapolation, the overspend is 6.5 million by the, predicted for the end of the year, that we would have to remedy that action over the next, that sum over the next 5 months of the remaining year. And also, could you just explain a little bit about the additional 3.5 million, which will then make that 6.5 million to 10 million, how that's arisen? Because I assume that with the Barnett formula, the consequentials would mean that all NHS staff would have the same increases, but obviously that's not true. Thank you.
You're on mute, Pete.
Thank you. Yeah, thanks, Robert. In terms of the first question, so yeah, you're quite right. So at the moment, our assessment of the further actions that have been identified would bring a potential benefit of circa £1 million. So that 6.5 million would become 5.5 million, assuming that they're delivered as expected. And that is right. That would be the gap that we need to reduce our expenditure going forward to the tune of that 5.5 million to remain within our original deficit plan. In terms of the English pay award, the easiest way to explain that is that there was an assumption made that the funding allocated would be similar to the model applied in Wales in relation to how inflation and growth funding is allocated in terms of our annual uplift and how the wage awards have been funded on an actual basis. What that means is that the English cost pressure in terms of increased prices, increased growth, and the wage award is all having to be included within our general 3.67% uplift, which creates that additional pressure. I've tried to explain that simply. It is a complex situation, but hopefully that brings a bit of clarity.
Robert, are you content?
Yes, thank you. Particularly there, Pete, you mentioned the implication of growth. So it reflects the higher level of growth, perhaps in the services. Thank you very much.
Simon, please.
Thank you, Chair. Similar, possibly same question that Robert raised around, do we have any sense as to why, given Powys is uniquely impacted by the pay award in England, Welsh Government is not providing the resource to enable the board to meet that cost? And how far is that wrapped up with the consequential of the increased funding announced in England that should flow through to Wales? And do we have any sense of whether Powys is being treated appropriately and fairly by Welsh Government in the onward allocation of any consequential that they are getting as a result of increased funding announced in Westminster, because it does seem like we've got an incredibly challenging financial position being made somewhat worse by choices being made in Welsh Government. And I just want to check how far we have a Welsh Government requiring from us some probably very unpalatable decisions, which in part are being required by the choices they are making in terms of the funding that's coming to Powys.
Thank you. Pete, just before you answer that, I wonder if it would be useful for you to include in your response Powys Teaching Health Board's position as regards the recent announcements of additional funding to tackle waiting lists, of course, on top of the further faster funding last year. Again, just for kind of clarity as to how that's affecting us financially. Thank you.
Okay, so to try and pick up on Simon's question, so in terms of the wage award and the impact around the English position, the wage award's obviously been significantly higher in this year compared to previous years, and that probably does create a bit of a factor in that. In terms of the additional funding made available in Wales for delivering RTT performance, we've not received any funding in that regard. We have received additional funds in terms of neurodevelopment and our action around improving our performance in that area. So what we do know is that a number of our Welsh providers have received additional funding in that regard, and we'll be working hard to make sure that the Powys population will benefit for that we don't in effect pay for that twice, because the funding's been allocated for that. In terms of the general consequential question, obviously there's a very, very complicated process to work through in terms of developing the Welsh budget. That is done on whatever basis that is determined based on the priorities as identified at a ministerial CABSEC government level, and then the funding's allocated on that basis. So in terms of whether it's fair or not, that's not something that I can really answer in a yes or no question, Simon, if I'm really honest. It's a very complicated position, and that funding is allocated in the best possible way for the benefit of the Welsh population is what I would say the aim, the priority is. But in terms of the recent funding being allocated against the two pots of money identified, that we haven't received anything significant against that in terms of our already delivered performance, because our waiting times are lower, are within those target levels for our provider in the main and for our commission services. So in terms of our English position, it's very hard to give a very short answer to that, so hopefully that's okay.
Yeah, thank you, Pete. I think no, I think that's a very clear answer. I think, but of course it juxtaposes with the information you shared earlier, isn't it, about the increased cost that we're bearing because of the overperformance of our English commission provider organisations. So, but I can see that Hayley wants to come in. If it's on this point, Hayley, please come in, and then I'll invite Steve Elliott to contribute.
Yeah, thank you. Pete's answered the question, but it was just 2 points really, and just in terms of timescale around this. So clearly we have the allocation of the 28 million to support recovery of waiting times for planned care has been allocated on a provider basis. So for our patients who are waiting in Welsh providers currently, they will get treated through that funding. And clearly as a commissioner, that's a bit of an administrative burden for us, because we then have to make sure we're not double paying for those costs, and we're working through that detail at the moment. We haven't formally received notification of the additional 22 million and how that's going to be allocated yet, although I know that that's in active discussion. And clearly Welsh Government are due to put before the Senedd the budget consequentials, I think I'm not going to give a date. I think it's the second week of December. I'll have to check my diary. So at that point, we'll be able to understand the approach that's been taken with regard to any allocation for either revenue or capital for the NHS as a result of those deliberations that are currently taking place in Welsh Government. At that point, Simon, we will look at it again and review whether we think that that is allocated in a way that supports us to deliver against the ministerial priorities and our strategic priorities as an organisation, and probably will need to revisit that as part of our deliberations in setting our annual plan for next year. It's a timing issue, Simon, at the moment, because we haven't yet received some of that formal information to consider. Thanks.
Steve Elliott, please.
Yeah, I'm probably going to cover points that have been raised before, but I just a couple of points really. One, going back to the English, the cost of the English Pay Awards, Pete. Can I just ask one relatively simple question: is whether the approach that Welsh Government are taking in terms of funding that this year is different to the way that they've treated that in previous years? So that's one question. I think you and Hayley have just touched on making sure that we avoid double paying for activity with Welsh providers. So just an assurance around that. And finally, in terms of the savings schemes, just what process is in place to push the schemes that are currently identified as a red potential, so that they might be translated into deliverable schemes, and also ensuring that the amber schemes are are on track and are delivered as well. Thanks.
Yeah, thank you, Steve. So in terms of the consistency of approach, that has changed over years, because in previous years the wage award has been included as part of the general uplift, so that will be a sort of a different sort of scenario for the funding stream. So there has been a level of consistency, but it has been different over the years. So it's not an easy yes or no one. The performance one, totally agree. The focus on savings is an ongoing approach. That every area is encouraged to have a pipeline of opportunities. They are our red schemes, which are then evaluated, and when determined, they can be moved into an actual delivery phase, go into amber and green. So it's a constant process. It's not something that stops. It's an ongoing challenge to all of us and all budget holders within the organisation.
Steve, you content, or would you like to come back on that?
Yeah, I suppose just to come back on the savings. So what is the process within the executive team to ensure that savings are being delivered? I suppose that's probably the best way of putting it.
So there's a layer of approach to this, Steve. It'll work all the way up through the organisation, so that it will start at the basic budget holder level meetings with their relevant finance business partner or member of the finance team, whereby their position is assessed and they're delivering their part of the savings, and that cascades up in terms of the financial performance meetings, which Hayley and myself have with all exec directors, just to pick up on the financial performance, including savings delivery. And then just to clarify that I also have, because of my portfolio includes estates and facilities, and also the finance department, I have one of those meetings where Hal Pullen, as my deputy, fulfills my role, and Hayley and Hal meet with myself. So just to give that bit of extra assurance around that.
Okay, I can see that Nicola would like to come in, and then we probably need to conclude this agenda item. But please, Nicola.
Thank you, Chair. I just wanted to give the board that assurance that we're working through the operational detail of our processes to ensure that we're not in quote unquote double paying for that additional plan care activity, which has been centrally funded. We have support from our Welsh Government colleagues to do that, and we'll be picking up that directly with our commissioned providers to make sure they understand that position and those processes as well. So I wanted to give that assurance to the board.
Thank you, Nick. So any concluding comments, Pete, before we move to the recommendations? Or
I don't think so. Thank you, Carl. I think the position is clear. I think everyone understands the position, the main cost drivers and reasons why we're in the position we face, and the need for urgent action to address it. So thank you.
Sorry, I've just noticed that Hayley has her hand up, so I will bring Hayley in before we go to the recommendation. Thank you.
Yeah, thank you. Just a couple of points from me. Clearly, some of this is discussions with between ourselves and individual providers, but also as part of this is also some of the arrangements are in the national joint commissioning space, particularly with regard to some of the cost pressures also against our forecast, for example, regarding specialised services. So some of these we're working on at an individual organisational level, and others we're working within the collective commissioning arrangements across Wales. So just wanted to bring that point across, and also the very clear view and position that Welsh Government have held from the beginning of the year, and clearly our escalated targeted intervention status is the expectation for us as a board to take the necessary action to be able to deliver the forecast that we set at the beginning of the year. So I wanted to bring those 2 points through quite clearly about what the ask is that we need to be considering as we move into those discussions in committee. Thank you.
Thank you, Hayley. So that brings me to the recommendation. I won't repeat the point, but Hayley's very articulated very well the fact that we will be meeting in committee later on to discuss these matters in more detail because of the commercial sensitivity around some of those issues, and indeed taking very seriously the Cabinet Secretary's and Welsh Government's expectation that we continue to meet our current financial forecast for the end of the year. But
sorry, Carl, sorry.
Please.
One other point, and remiss me to mention, is that on the back of our deficit position, we will be submitting a response to Welsh Government in terms of our strategic cash support that will be needed this year, given our deficit position. It's included in the paper, but important to note that from the board that we will be submitting that request.
Yeah, thanks,
Sorry,
Pete.
thank you.
No, thank you. So the recommendation is that we receive the financial report. We take assurance that the organisation has effective financial monitoring and reporting mechanisms in place. We note the current increased risk of achieving the projected in-year forecast for 24-25. And we also note that further ongoing in-year mitigations will need to be delivered to achieve that in-year forecast. This has also been carefully considered by the Delivery and Performance Committee, as we heard earlier when that committee reported to us. But does anyone want to indicate that they don't support the recommendation? That is supported unanimously. We move to item 4.3 and the Integrated Quality and Performance Report, and to Nicola. Thank you.
Thank you, Chair. So I'm presenting the month 6 Integrated Quality and Performance Report. As noted previously in the meeting under both yourself, the Chair and the Chief Executive's report, whilst we're in targeted intervention for a number of domains, we are in routine monitoring for performance and quality. And together with the report at item 4.4 on the progress of delivery of our plan, these reports are really important to allow the board to monitor and be assured on the performance and delivery of our plans. On that basis, I'm going to acknowledge some of our achievements and progress, as well as our areas for improvement in terms of performance. So we do have a number of our preventative measures, really good performance, and to acknowledge that particularly in some of the vaccination measures, we do perform really well in terms of the NHS Wales context, and again that intersects with the winter plan paper that we'll be receiving later. In month 6, there was improvement with regards to the referral to treatment planned care measures, and we are achieving several of those, as well as achieving the therapies waiting times targets. Our own MIUs perform very well in terms of the unscheduled care measures. And again, as we've discussed under the temporary service change paper, we will continue to track the impact of the service change on our good performance in those areas. You'll also note in the paper, as we've discussed under some of the committee reports, is that in October, the mental health services were de-escalated in terms of internal escalation, following really good improvement led by that service. There are, however, a number of areas requiring further improvement. And again, as we've acknowledged previously in the meeting and some of the committee reports, neurodevelopmental services for children and young people were put into internal escalation in October. The historical performance in terms of access is described in this paper, because obviously this is a retrospective report of month 6, but to assure the board that there is evidence through the escalation meetings of operational and service improvement, as well as, again, as we acknowledged in the last report, we have had Welsh Government funding to reduce the waiting times for children and their families to access this service. So we are expecting those capacity improvements to be evident in our reports from November onwards, which will be month 8. But as well as the access times which are described in this report, the escalation also addresses the UK standards for those services and very much framed within the duty of quality. There's good performance generally on our mental health measures, but further improvements to make on mental health adult Part 1A measure, and again expecting that to be evidenced in the reports from month 8 onwards. There continues to be steady improvement in our diagnostics waiting times, as planned in our trajectory, and we continue to work hard to improve our colonoscopy waiting times, which is dependent on in-reach services, and some fragility is evident, particularly around our JAG accreditation, which again we are working really closely with our commissioned provider on that, and there have been chief exec conversations on that as well. The differential, as we've acknowledged in the finance report, between the NHS England and the NHS Wales planned care waiting times remains, which is obviously a benefit to our patients who access those services in England, but we have discussed also the financial implications of that for us. And again, as we discussed under the finance report, there's been additional monies released into the system for planned care in Wales, which again we'd expect to see the benefits from month 8 onwards for our patients accessing services in the providers. And as we also gave that assurance to the board, we are putting detailed processes in place to ensure that the financial consequence for that is minimised. So happy to take any questions or comments on the IQPR, Chair.
Thank you, Nick. Robert, please.
Yeah, specific question, Nick, about the in-reach. I'm wondering, every meeting really, although it's perhaps a different specialism, we get told about difficulties in maintaining the service where in-reach is provided. I'm just wondering what the future is for our in-reach really, whether we have to think again because or maybe even not do some of the in-reach and accept that they have to go to DGHs. And it's now it's a regular feature, isn't it? And every time we think that we've got through that particular problem, another similar one arises. Thank you.
Please come back, Nick, if you'd like.
Yes, thank you. Thank you, Robert. And the question was raised at the last Delivery and Performance Committee, and we have a position statement on our in-reach services coming to the next committee, which is next week. It is a complex area for us. And there are a range of mitigations and solutions that we're already putting in place, but also that we're considering under the transformation programme. So just to note, there is that further sort of deep dive position statement paper to come into DPC next week so that we can have that conversation.
I can see that our medical director, Kate, also, is it on this point, Kate? If so, please come in.
Yes, it is. Thank you, Chair. So yeah, absolutely, Robert, it is an area of concern, and I think we are seeing fragility across the whole system, which is definitely impacting. I think importantly and positively, then in terms of our provider service and our own governance, and that is strengthened. We've appointed an AMD for planned care who's now able to keep a much tighter grip on the quality aspects than we've been previously able to do. And we've got additional senior nursing leadership in that space as well. So yes, it clearly is of concern in terms of both performance and quality, but just to assure in terms of our internal processes and monitoring, it's been looked at very, very carefully. We do need to start to think more imaginatively about the way we're delivering our services. And we do need to review some of our working arrangements. One option is, rather than an SLA in reach, to look at things like joint appointments, which would give us more stability. And that's certainly something that we are actively exploring with some of our neighbouring health boards. That said, we know that recruitment is very difficult across, so it's not straightforward. But you're absolutely right. We have got an active eye on it, and we need to be considering where we're safe, what else we need to do to mitigate.
Thank you. Content, Robert?
Yes, thank you, Chair.
Okay. Mick, do come in.
Thank you, Chair. Nick, I think if I'm correctly understanding the summary you just provided, I think it'd be fair to say that, you know, although there are areas which require, you know, continued focus, the overall performance position in relation to services provided directly by the health board is reasonably positive. The really difficult performance challenges are those, and those would probably impact more significantly on the, you know, the quality and safety of service that we provide to Powys residents. So those relating to commissioned services outside Powys. So I'm just interested in understanding a bit better what levers we have to influence performance externally, and how we're applying those, and what more could be done to drive out incremental improvement.
Thank you, Mick. I think there's the transactional levers that we have in terms of performance management, the way that we design and implement our contracts with those providers as well, and look for efficiency, value, you know, pricing reform, and my predecessor was certainly doing a lot in that space for our finance colleagues, and we're continuing with that, and you know, accelerating that, particularly as we look to you know, as we performance manage the contracts in year, but also as we look to the next contracting round. Certainly through the commissioning for value work stream, there's a lot to go at in terms of a lot of those areas on the technical contracting side that we can still do. But it intersects really closely with our transformation programme. You know, our strategic aim is to make sure that services that can be provided safely in Powys are provided safely in Powys, and our transformation programme accelerating again to make sure that we can do that, and only the patients that need complex care that need to go to those commission providers go, and that we're making sure that all of that is evidence-based and that the outcomes are good. That is a key focus of our work again through the commissioning for value work stream and the transformation programme as we go forward. So there's still a lot we can do, that we are already doing, and that we can continue to accelerate as we continue to transform.
Thank you, Mick. Just on the, I know that Chris and Haley want to come in. Just on the contracts, Nicola, it was something that I picked up in Pete's report, actually, and it may be that I'm absolutely misreading this, and please do correct. So it was about the status of the contracts, and it was actually page 5 of the finance report, where it says that the Welsh LTAs were signed off by the 30th of June, the deadline, and contract proposals from English providers are being received and currently being reviewed. Again, forgive me if I'm misreading it. Does that mean that the contracts with our English providers have not yet been signed off for this year?
Thank you for the question, Chair. The contracts are a different status in terms of sign-off. So some of them are, and some of them we are following on from Mick's comment, a question, challenging and making sure that we're getting the best value from those contracts as we seek to sign those off over the before Christmas. So again, an area of work that we are accelerating with a number of meetings now over the next months to bottom those out. But clearly we need to make sure that we are getting the best value from those contracts and coming to those agreements with our providers.
Okay, Hayley, I think, wants to come in. Please do, Hayley.
Yeah, so just a couple of additional points just to add. So the deadline to work for the sign-off process within Wales was June, which we met. That's actually moving forward next year to being earlier in the year. That didn't apply that target because that is a signal for anything that needs to go for escalation and mediation to Welsh Government. So we do work to a slightly different timescale with English providers, but it is very important that we do it as early as we can in the year, but recognising some of the in-year challenges that we've had. We've talked previously, for example, around data availability in some of our providers, etc. That has had an impact this year in our ability to sign some of those off. And absolutely Nick's point around the issues around challenging and making sure that we're getting the right outcome is where we're at the moment. But the earlier in the year that we can do this as a commissioner, the better for all concerned. And I think the expectation will increase for the Welsh providers, the dates moving by a couple of months. The similar approach we'll need to do for English providers. But on the strategic levers point that Mick raised, you know, I am keen to see allocation of funding, for example, to come through on a commissioner basis, because then that does enable us to take potentially different choices about how we would want to access and purchase care for our population in Powys. So I think some of the strategic levers we could have available to us around, for example, how we manage the backlog hasn't been available to us this year, Mick. And I think it's tied to the earlier conversation that we had around the allocation of funding for a recovery of the backlog of planned care treatment. Now that would bring its challenges, because part of the reason that pathways go to where they're going at the moment is because that is the nearest and most accessible place of treatment for our patients. But if we were allocated that funding on a commissioner basis, we could bring other potential options to the table. So I think there are other strategic levers we could use if we had the funding allocated on a commissioner basis going forward. And I think that's something we should be encouraging and advocating as a health board in our discussions with Welsh Government.
Absolutely. Thank you, Hayley. And Nick, perhaps you and I could pick up a conversation outside the meeting in terms of the contracts and so on. You know, I'd just like to understand perhaps a bit better how the whole process works. Month 7 feels late, but it may be that there are things that I just need to understand better. But we can pick that conversation up outside the meeting. Thank you. And Chris, please.
Thank you, Chair, and thank you, Nicola, for the report. I think it's helpful. I'm turning to page 4 of your report, which is page 140 in my pack. It's regarding the neurodevelopment service, which you highlight is significantly challenged, and there was some reduction in performance, which I'll come on to. First of all, I just wanted to understand, is the reason for this challenge due to vacancies, or is it staff sickness? What is the reason for that? Likewise then, where is the demand coming from? Is that coming from education? Is it coming from primary care? Is it coming from self-referrals? And how do we manage that expectation then if we've got challenges in providing that service? And has any of that come about due to the COVID situation in relation to some of those children coming into that service. And then it says there was a reduction in performance by 34.3 compared to 37.2. I'm of what is my question, because I'm seeing 34%. Is that a reduction of 3% approximately on the previous 37? I'm trying to get it into context of that on there, because it could be then seen as being an improvement if you on the, so I'm struggling with those numbers to understand the context of what.
Thank you, Chris. A number of questions there, and I'll also ask Claire Roach, the Director of Nursing, who's the operational executive lead for this area, to come in as well. There is a demand and capacity imbalance in the service, which has led to the long waiting times and a backlog. And there's a number of drivers for that, which Claire, I'm sure, will describe. But these are nationally seen. The incidence of autism and ADHD and other neurodevelopmental services in children, I think there's an element of it being better known, being better picked up in early years settings and education, as well as through healthcare, primary care, and by parents themselves. So it is a national picture of growing demand for these services that all health boards in Wales are experiencing, and it is UK-wide as well. And Claire will describe a bit more about the work we're doing to improve the demand and capacity match and to reduce the backlog, which we are really pleased that we've had that funding from Welsh Government, which again all health boards have had, because this is a national problem, to improve that service from that access point of view for our patients and our families. So at that point, I'm going to hand over to Claire just to add a little bit more about the other areas that you raised.
Yeah, thank you, Nicola. Thank you, Chris, and really important questions. I think there is multiple responses to these questions. So as you know, we've undertaken a diagnostic deep dive over the summer period. We've identified a number of improvements that we need to make locally in terms of our processes and our arrangements for seeing children, and that is the work that we've been progressing at pace to be able to address the backlog of children so that we can attempt to see them in a timely manner. We've got a really robust action plan for that. It is part of the local escalation, and of course the funding that we've had for Welsh Government is very much informing that improvement plan in terms of being able to get traction to be able to maximise our opportunity to see those children. But there's also a much wider issue here that is not just an issue for Powys, but an issue nationally. And you are right to raise the, did COVID have an impact of that? We are working with our public health colleagues to be able to fully understand the demand and capacity for and the needs for these children, and also to be able to understand what is an effective and appropriate response to children, because as in many other circumstances, not all children will require the same level of intervention, and therefore we need to be ensuring that we are making an assessment in a really timely manner, so that actually we could perhaps in many cases get some low level of support and intervention that would really support our children and free up our services to be available then for children with more complex needs. I think very importantly today, it is important for me to share with the board that both today and tomorrow, there is an accelerated design event being held in Lampeter for all health organisations, local authorities and relevant organisations involved in this area of children's care, recognising that actually we need to radically transform our services and do something quite different. And we have sent quite a considerable delegation from both Powys Teaching Health Board and linked in with Powys County Council to look at how we can both inform that event, but how we can learn for others. Thank you very much.
Thank you, Claire. Chris, do you want to come back on anything, or are you content? You're on mute, Chris.
No, I'll pick this up outside of the meeting, Chair. But it's some of this has been touched off in other committees that I'm involved in, and likewise, I was at a school as a school governor yesterday, and it came up in a different context. Hence, why I was raising some of the questions. Yeah.
Thank you. Nick, your hand is up. Also, Hayley's. I don't know which is best to take first. Hayley, do you want to come in now or after?
I'll let
Nicola?
Nick come in and then I'll come in after. Thanks.
Okay.
Yeah.
Thank you.
Thank you, Chair. I was going to pick up Chris's technical question about the measure and the way it's described in the paper and the percentages. So the standard is that we should be meeting a standard of 26 weeks to assessment for these children and young people. And the way the paper is written, apologies if there's any confusion, what at this point in month 6, our performance against that measure was unfortunately deteriorating. So whereas we had 37.2% performance in month 5, our compliance with the measure deteriorated to 34.3 in month 6. And as I was explaining, this is a historical report, and we are expecting that improvement because of all the operational capacity improvements that have been put in place to be evidenced from November onwards.
Please, Hayley.
Yeah, it was on that point, just a little bit more information. So this may feel counterintuitive for colleagues, but placing the service into escalation, we are aware whilst we're making these improvements to the sort of position, that the measures pathway, which is what we report here, to assessment time has worsened, and that's because of the additional work and capacity that's been directed towards assessments in progress and the backlog there. But clearly we've also had the allocation of the additional funding from Welsh Government to improve the backlog position as well. And we're just working through what we expect that revised trajectory to now look, so that you can see the balance between the improvement works we need to do and the additional investment and capacity we'll be able to access as a result of securing the additional investment. And I can't remember the figure, I think it's about 240,000 that we've had from Welsh Government to help with this. As for the really important point about the shape and nature of our referrals, I think you can see in the report the substantial increase in referrals for assessment into this service. And I know that the rapid design event that Claire just referenced is taking place today and tomorrow in Lampeter. I chaired the National Strategic Programme for Mental Health meeting yesterday. We are very keen to take further action at a national level to really understand the sort of referral demand and understanding what that picture looks like at an all Wales basis with the support of Public Health Wales. So thought they were really important matters to share as well. Thank you.
Thank you, Hayley. So I can't see that anyone else wants to contribute in terms of this report. Any closing comments, Nick, or should we go to the recommendation?
Happy to move to the recommendation. Thank you, Chair.
Okay, well, thank you. The recommendation is that we discuss the content of the report. I think we can say that we've done that we take assurance that the Health Board has appropriate systems in place to monitor performance and to respond to relevant issues. Once again, just to say that we did receive assurance earlier in our meeting that this report has also been scrutinised in some detail by our Delivery and Performance Committee. Does anybody want to indicate that they don't support that recommendation? Nope. So that's supported once again unanimously. We turn to item 4.4 and the annual delivery plan, and we're coming back to you, Nick.
Thank you, Chair. Again, as previously acknowledged in the meeting through the Chairs and Chief Executives report, and again feeding into the approach for the delivery of the next year's report. This report allows the board to monitor and ensure itself on delivery of our plan for this year. And this is the Q2 report, so again, a retrospective report. And as we've noted previously, the plan was approved by the board, but is not supported by Welsh Government. But nevertheless, as we seek to deliver our strategic aims and objectives, really important that we as an organisation monitor progress with delivery, and we are also required to provide this report to Welsh Government as part of the national reporting arrangements, which we will do after the board has considered it today. Overall, there is good progress with the delivery of the plan as at Q2, with high delivery confidence, medium to high delivery confidence around most of the actions and objectives. There are a small number that were off track at this time regarding some of our commissioned community and primary care services, our major health conditions plan, which has been picked up and revised through the transformation programme, and a few digital schemes where the intersection with national funding or projects has led to delay. So on that basis, I'm happy to take any questions or comments on the paper, Chair. Thank you.
Thank you, Nicola. Colleagues, does anyone want to ask a question or make a comment in relation to the report? Mick, please.
Thanks, Chair. It's a question and an observation, if I may. So just looking at the summary overview on page 205 of the board book, that if I'm reading it correctly, the proportion of actions not yet due to be started, so presumably yet to be delivered in the second half of the year, is around 57%. And there's 22% still in varying states of progress. So that's almost, round figures, 80% still to be started. I'm just very conscious that we're coming into a traditionally busy period for the NHS. We've got the additional pressures now of raised escalation levels. I just wondered whether we should be concerned about that profile. I know there's individual confidence levels against individual actions, but just wondering how confident we are that we will substantially deliver against the activities we're expecting to, or are we, facing a position where we might have to roll some forward into the next year? So that was the question. The observation was, really impressive amount of activity and action taking place. The plan for me is really well structured. The process appears to be well managed, but there's a limited use of metrics in the plan. Very few, if any, outcome measures. So the question I'm kind of left with is: so what difference has all this activity made? Is it actually achieving what we set out to achieve? Is it making a difference in the long term? And I appreciate that's not an easy question to answer, and it takes time to build an outcome-based, performance framework. But I just wondered, given that we're going to be discussing the next planning cycle later in the agenda, I just wondered whether the plan is that going forward there will be an increased use of metrics and an increased focus on outcomes.
Are you happy for me to respond?
Yes,
Chair?
please do.
Thank you. Yeah. Thank you for that on the first point, Mick. And as you know, we do discuss with the executive leads and executive committee that delivery confidence, both of the actions that are yet to be started and the ones that have already been started. And to give you assurance that we do scrutinise and challenge ourselves quite hard on that. And as I said in my introduction, there is medium to high delivery confidence across all of those actions for the rest of the year. I think in terms of your other comment, funny enough, it was something I was thinking about yesterday. And again, I think we will seek to improve that further going forward in terms of the impact and the outcomes and the actions and how we measure those. And I will be asking the team to have a look at what the health boards do in that circumstance as well, so we can pick up if there's any learning from other areas in terms of how we do that. I imagine it'll be iterative improvement, but certainly looking to iterate it in that way as we develop the plan for this year.
Yeah, thanks, Nick. If I could just come back, Chair, I think, as I was going through it, I saw there was very significant links across into the financial plan and into the, into the performance framework, and it probably doesn't need separate performance metrics or separate outcome-based measures, but it's just making the links, isn't it, between those different plans?
Yeah, and I know whether health boards have ways of doing that, so I was just going to ask the team to review those, see which ones we would prefer to use. Thank you.
Thanks, Mick. A really important point. And thank you, Nick, for the response. And I know that Hayley wants to come in, but I think it links as well with the expectations placed upon us by Audit Wales and others to become increasingly more focused on the so what question. What difference have we made, and not just what have we delivered. But Hayley, please come in.
Yeah, you've picked up that feedback from Audit Wales. I agree with Mick's point, and I think over the years we've tried different ways of addressing this, and I see several of the papers that we receive regularly, so the Finance Performance Report, the Integrated Performance Report, and this annual plan assessment. You need to look at it as a complementary suite of papers, and there's a question about, as Nick said, is there anything more we can do to draw those together a little bit clearer? But I think there is more work still. If you look at a number of the measures, they're quite process focused, and there's still more work for us to do on the outcome measures, as Audit Wales has mentioned. So I think that's a further work for development and maturity as we go forward. So I would always say, when I look at these papers, I look at the three together, because then you can, I think there's something for us about how we summarise that, so we can make the connections a little bit clearer for the meetings. On the issue around confidence in year delivery, this is something that concerns me, Mick, every year, in that we go into what I describe as often the highest pressure months, with a substantial amount of annual plan delivery to deliver during those months. And a couple of particular areas that always feel difficult, like capital is another area. We saw that in the financial report about our spend to date at month 7 and what we've got to deliver before year end. So actions like the audit activity across our organisation, trying to front load that in the earlier parts of the year, so that we're not also loaded with a backlog of audit activity, etc., is something that we take into account. But there will be every year. I don't think I've ever been here where we haven't rolled over a couple of actions from our annual plan. Not large numbers, but there will be some that will be potentially deferred and continued into next year. And that's partly about the discussion that we have about how ambitious we want to be around the annual plan delivery versus the ambition versus our confidence to deliver. So I would expect, again, the majority of the actions to be delivered within the year, this pattern we follow year on year. But I think that context is everything. So if we have the expectations of what we're going to be facing in the next few months, continue on the planning parameters in which we set the annual plan, the confidence remains the same. But clearly, if there was a major issue, major incidents, etc., that we had to deal with, that might defer further work. So I think what would be really helpful is, when we see the Q3 report coming back, is that we pull out that very point, Mick, which is giving a clear indication of any ones that we think might need to feature going into next year, and doing that in Q3, rather than it being a shock to the board in Q4 if we think we're not going to get something over the line. But as I said, the assessment that we've had, there's nothing that's been highlighted at this point where we need to draw to the attention of the board at Q2.
Thank you. So we conclude this item, and Nick, any closing comments before recommendations?
No, thank you, Chair.
Okay.
Recommendations.
Thank you. So we're asked to consider the report ahead of submission to Welsh Government. I think we've done that, and to take assurance that there is a process in place for monitoring progress against plan. And also important to note that our Delivery and Performance Committee has once again, in its report to us, provided assurance on the back of its detailed scrutiny. And so given that, is there anyone that wants to indicate they don't support the recommendation? That too is supported unanimously. Thank you. We now invite Helen to introduce and to speak to the report on the corporate risk register. Thank you, Helen.
Thank you, Carl. So pleased to present this report to the board today. As the board is well aware, it's a format that you've seen now a number of times. And of course, the corporate risk register forms a key part of our board assurance framework. As previously reported, we retain the 12 corporate risks on the register. 9 of those are presented in these papers today in detail. Risks 8, 11 and 12, which relate to cybersecurity, power outage and national digital programmes, are reserved for our in-committee meeting, given the sensitivity, particularly of some of the actions in the detail of that report. However, the heat map, the summary, the scoring is all available in the report that you're receiving here in this meeting. Just in terms of assurance, the risk register as a whole has been reviewed by our risk and assurance group. That's largely a group of our deputy directors who have operational responsibility across the organisation. It's then reviewed by our executive committee, which includes all of our senior risk owners as well. We've put a real focus over recent months on each of our individual board committees, seeking assurance and doing a more detailed dive into the risks on behalf of the board for the risks that fit within each of the committee's remit, and that has taken place as over the last quarter. So there are no significant changes to report to the board today in terms of risks, risk descriptors, risk appetite, risk scoring. There has been some ongoing updates to the action plans, as you would expect to see, and that continues to be updated and iterated every meeting and every time we update, and the assurance levels have continued to be reviewed as well. So really, Carl, nothing of any substance to report today in the context of change, to offer the assurance that it's been through all of our internal mechanisms, including that enhanced review and scrutiny from each of the board subcommittees as well. But very happy to take any questions for which I might draw senior risk owners in if needed. Thank you.
Thank you, Helen. It's really helpful that you've outlined the fact that we have now, if you like, started to ask individual committees to pull out information from the corporate risk register to delve into more detail in relation to the risks that are associated with the remit of that particular committee. Because you know, the risk register is it's only useful if we make it useful, and so it does need to drive forward our work and our outcomes-based work, as we indicated earlier. And as I'm talking, I don't know whether any of the committee chairs, noting that we have 2 or 3 committee chair colleagues not with us today, or any members of our committees that might want to offer an observation as to how that seems to be working. But I'll pause to see whether anyone wants to come in and offer a comment in relation to the corporate risk register. Robert, please.
Yeah, just to say, I like the way that the risks are split up and attributed to the boards. It also it means that we have more time, if you like, to look at the data on which those judgments are made. It's not always hard science, as Helen knows. Sometimes it's based on qualitative information, but I think it's a step forward. Thank you.
And Steve, please.
Yeah, I also support the format. I just wanted to raise an observation really about CRR 001, the financial forecast one. Obviously, subject to conversations we'll have later. At the moment, there's a increasing likelihood that the plan forecast won't be delivered. So it's just an observation that we would possibly expect that rate score to change next time.
Thank you. And Simon.
Thank you, Chair. And not a similar point, the query comment of detail on CRR 010, the public health event emergency. I guess the question here is, given that the vast majority of controls are in place and have reasonable or substantial assurance. I know there's a couple at risk. I just wondered whether we should be seeing a difference between the inherent risk rating at 4 and 4 16 to the current risk rating. I just wonder whether the likelihood or impact reduces given actually quite a confident position around the controls. But it's more of a query around the starting point and the current risk assessment.
Helen, please.
Yeah, thanks, Carl. So just thanks for the comments on the register and the way it's being used at committees from colleagues as well. That's very welcome. Steve, just in regards to your point, Pete may want to comment on risk 1. I agree with you entirely. I think there is an absolute case to reconsider the scoring, depending on the actions taken and mitigations, obviously. But I think you're absolutely right to flag that there may well be a change in scoring risk 0-1 at the next point. Simon, thank you for raising the point on the public health risk 0-1-0. I'm just going to invite Mez to comment on that if she would be happy to. Thanks, Mez.
Yeah, thank you, Ms. Bowley, Director of Public Health. So thank you. Yeah, so as Helen said, so we review the risks regularly and also in terms of emergency planning as well. And we took a paper to PPH committee on our approach. So in terms of risk on UK register, pandemic flu remains one of those highest sort of risk, and we are awaiting also for an updated framework for respiratory risks. It's an element from Welsh Government, which is due shortly. So the risk really scoring, whilst we have plans in place, we need to test them regularly, obviously, but it is related and aligned to National Risk Register and the Regional Risk Register element, really. And what we don't know, if in the event of another pandemic, what that pandemic would be, we can develop plans, etc. And currently, you'll see reference in the plan that we're doing work on high consequences infection diseases, which is MPOX currently, to make sure we have pathways in place as well. So that's the reason why the scoring is so currently, but equally, we're happy to review as well, but hope that's helpful.
That's great. Thank you.
Okay. Well, Helen, thank you so much. Any closing remarks or not?
Not from me, Carl. Thank you.
Okay, thank you. In which case, we're asked to receive the Corporate Risk Register as a full and accurate record of the Health Board's strategic risks, and to take assurance on the controls and assurance to manage strategic risks, and that there are actions to address any identified gaps. This report has had detailed scrutiny from the Exec Committee, and as we mentioned earlier, is now, if you like, farmed out to our other committees in relation to their particular remit. So does anyone want to indicate they don't support the recommendation? That too is supported unanimously, which takes us back to Nicola and to winter planning. Thank you, Nicola.
Thank you, Chair. The paper that's before the board today is for the board to approve support for the paper to be formally approved by the Regional Partnership Board on the 16th of December. The plan has been developed in partnership through the RPB mechanisms and has been scrutinised and assured through our joint leadership team, the RPP executive group management group, and the Planning, Partnership and Public Health Committee. So there's been a lot of work to develop it, make sure it's robust. It brings together a number of requirements and policy drivers, most significantly the Care Action Committee requirements, and as acknowledged in the Chair and Chief Executive's report earlier, there was a detailed session with the Cabinet Secretary on that for our region last week. Our vaccination programmes, which the board has received separate papers on in September, our 6 goals urgent emergency care plan, our detailed capacity requirements, and again responding to the other policy drivers and requirements, including our escalation and coordination arrangements. As I acknowledged earlier in the meeting, this does intersect with our finance and performance permission, both in our own capacity and in our commissioned providers, to ensure that we can provide quality of care for our patients during the winter period. And it is linked to some extent to the temporary services changes, particularly around the ready to go wards and enhanced rehab, as previously discussed as well. I'm so happy to take any comments or questions, and I think David, from an operational point of view, is also will also help to answer those, Chair.
Thank you very much. Robert, please.
If I can just start with an observation. If you went back sort of 4 years, the implication of a winter plan was that the actions were seasonal. And I wonder, apart from vaccination, and since the health system has been at full speed for years now, whether a lot in this plan is simply a restatement of existing ongoing actions. If you like, we're in winter throughout the year. That was just my sort of thought. And then the second thing is a question. If there are new activities and actions planned, have they been fully costed? Thank you.
Nick, would you like to come back on that, please?
Thank you.
David?
I think probably if it might be helpful for David to come in on those points. Thank you.
David, please.
Thank you. And yes, I would agree, Robert. It's winter every day for us these days, and has been pretty much post-COVID, true of the most of the NHS. From our perspective, a lot of the actions certainly are underpinned. So we do include in the winter plan our daily activities, our regular rhythm, our battle rhythm in terms of managing that. But as you will see, there are new actions, which includes some of those Care Action Committee priorities that we've talked about, and they have been introduced. They have been costed, and that is part of the national support, if you like, to that work. We've committed the resources we've been provided. Things like the DigiFlow systems and making sure that we are able to better manage our flow systems and our information. The work we're doing around our extending and development of reablement services, for example. So a lot of this is additional work that we do as part of the winter planning, the regular rhythm. And I think what this has become is, if you like, an annual refresh at about this time of year, which offers the system assurance that we are going into what's going to be a busier period, at least battle ready, if you like.
Robert, you okay?
Excellent answer. Thank you.
Thank you. Steve, please. Sorry, Steve, I can see again that Hayley wants to come in. Is it on this point, Hayley? If so, please do, or we'll go to Steve.
Yeah, it was just to say I agree with everything that David has said about the pressure is felt all year round. However, with the winter period, particularly around surge capacity planning, etc., there are additional arrangements that we have in place that come in at this time of year. So, for example, earlier this week, I was on a national call, and we've got at the moment increased higher levels of intensity of RSV in the system, which is resulting in substantial pressure on both paediatric admissions, and we've been asked to step up and check our arrangements around critical care capacity. So although it's a pressure all year round, there are heightened levels of both demand and expectation around surge planning and escalation planning for us as a whole system. And I think particularly, you know, we've I'm mentioning it again, but you know, the flooding and the adverse weather in some of our communities earlier this week, there's been a number of issues which we manage at this time of year, which means that we have to actually step up the intensity in terms of our operational arrangements in managing the system pressures. So I do think it is slightly different for winter planning rather than more of the same, because it is also about how the whole system responds in those escalated scenarios. So just wanted to add that point. Thanks.
Thank you, Hayley. Please come in, Steve.
Yeah, thank you, Nick. A lot of detail in this report and a lot of good positive stuff in there. What I was struggling with, a couple of things really. One is I'm just struggling to pull out where particular concerns around potential areas of weakness or threats that you know that may be facing us, that maybe we haven't, or you know, what are the mitigating actions that we need to take in that. The other thing that you mentioned, Nick, about the intersection with the finance report, there seems to be just a bit of a disconnect between some of the more positive comments in this plan around progress or on pathways of care delays compared to what we've seen coming through the finance report, which is appears to be more of an increasing pressure in that area. So I wonder if you could just sort of explain the connection there. Thanks.
Yeah, thank you. David will comment more fully, but certainly on your latter point, we know that the local authority have done a lot of work on their market development and other areas, particularly around domiciliary care, and are reporting that they are able to release more hours into the system of domiciliary care, like quite a significant amount of hours more. I think, and David will comment further, I know he's got his hand up. What we're not seeing at the moment is that impact on certainly the bed days in our hospitals or our commissioned providers, and the feedback from the local authority is that because capacity's increased, but the demand has also increased, and obviously there's a pool of people that we don't necessarily see who are waiting for domiciliary care in the community as well. So I think that might explain to some extent why the one thing is not necessarily following the other. I suppose what we would need to acknowledge is the situation would be even worse if the local authority hadn't done all that underlying work as well. But I know David will comment further on that and the risks.
Yeah, I mean, just to say that I think Nick's covered it fairly comprehensively. We would recognise that this is a very friable set of metrics. The reality is that it can change quite quickly, and in particular in Powys with those smaller numbers. So it probably accounts for why you see also some of that variability. In terms of those wider risks, we're confident in our delivery plan, but there are some external elements. We've touched on some of these already, things like community infection rates, for example, which affect both demand and indeed the availability of workforce, which can obviously cause some challenges to us. And we do what we can around the mitigation of that, including making sure we support our staff to get fully vaccinated and do things like making sure that our IPC arrangements and any learning from previous outbreaks are implemented. So we do what we can within the context of what we can, but there are ongoing risks around a number of elements, including such things as infection rates, or indeed just a recognition that weather and such like adverse weather can drive different cohorts of patients through to emergency care, which obviously increases our workload, and it's just really a risk that we have to respond to rather than can effectively mitigate all the time.
Okay, Steve? Or...
Yeah, that's lovely. Thank you.
Thank you. No one else is indicating that they want to come in. So again, an opportunity for any closing comments, Nicola, or not, as you wish. Okay. in which case we're asked to take assurance that arrangements are in place for system resilience planning across the Powys Regional Partnership Board. We take assurance that Powys Teaching Health Board has actively contributed to those arrangements. We receive the RPB System Resilience Plan that we've just considered, which is the end product of those arrangements across partners, and we approve that our board support is given to the final approval of the plan, which will take place at the RPB meeting in December. And once again, to note that this has also been scrutinised in detail by our PPPH committee, as we heard earlier in the report from that committee. So anyone wishing to indicate that they don't support that recommendation? That is supported, therefore, and thank you very much indeed. We're working, Nicola, really hard today because we're coming back to you, Nick, for the integrated plan report. Thank you.
Thank you, Chair. So we've talked a lot about the delivery of the plan for this year. This paper initiates the process and our planning approach for developing our plan for next year. Again, members have had the opportunity to comment on this at both board development session and via the PPPH committee. The paper sets out the governance and timeline, particularly around the committee and board governance, and when members will expect to see products as we develop the plan. And between now and the end of March, when we expect we will need to submit it to Welsh Government. And the plan is an integrated plan, and mechanisms have already been set up both internally through our core group to integrate across the parameters of service, finance, workforce and digital, and to take into account obviously our planning to improve performance and mitigate risk. And arrangements that are in place, building on the reasonable assurance of last year's process by internal audit to make sure that our plan aligns with the plans of our partners, both our NHS partners and through the RPB. In the context of us now being in targeted intervention for planning, performance and finance, obviously really important that we build on those robust processes that we already have. But the theme for this plan is also risk, recovery and sustainability. As acknowledged throughout this meeting, it's also equally important that we plan to maintain our good progress on performance, quality, governance and leadership. And we do that through the risk element of the plan and ensuring that the quality and the duty of quality is a golden thread throughout. Clearly, there's a lot to do in the recovery space, and we've talked around the financial situation and financial challenges, as well as some of the underlying structural issues that we have that are unique to our health board. But we are actively involved in value and sustainability work streams, and that those will be described in that recovery element. And we are accelerating our route map to sustainability, our transformational change based on the health and care strategy, our strong strategic framework through the health and care strategy and the extensive work that was done on the discovery and design phase through Better Together. We don't have the national NHS Wales planning framework yet. We understand that that is due over the next week to 10 days. We also understand that that will include the main ministerial measures for performance, which hasn't always been the case in previous years, but will be very much welcomed in terms of making sure that we are robust in our planning to perform. And as previously discussed, allocation letters and further clarity around the financial flows for next year. We usually would expect those in December. The paper covers 3 projects for approval today, a refresh of the strategic context to ensure that we are responding well to that, and taking forward our strategic aims through our set of strategic priorities, And as again previously discussed, we are expecting women's health and children's services and the quality and performance of those to be part of the policy drivers in the planning framework, and therefore we've built those into our strategic priorities, and we'll be responding that that in our plan. We've also appended our first draft planning maturity matrix for the board to approve today. It is part of our accountability conditions as they currently stand for us to complete the planning maturity matrix. And there's also a requirement from Welsh Government that we do that on an ongoing basis every 6 months going forward. The board will be aware that both at the development session and at the committee, we had a great deal of discussion about the realistic and deliverable element of that maturity matrix. And through those discussions and really thinking about our status in terms of the criteria is laid out, we have scored that as a 2, with obviously opportunity to improve as we take our planning approach forward, as described in the paper. In terms of really important touch points, we will expect that the chief executive will need to send in an accountable officer letter at some point in Q4, probably in February, based on previous experience, as to whether this is a potentially supportable a plan by Welsh Government or not. With regards to the statutory planning duty, and therefore discussions with the board, both through board development and formally in January, will be really important to inform that letter and that accountable officer call. And as I say, we are on track to bring the final plan for approval to the board in March. Happy to take any comments and questions, Chair. Thank you.
Thanks, Nick. Colleagues, would anyone like to ask a question in terms of this forward-looking planning process and the work that's going into the plan for the next period? Simon, please.
Thank you, Chair. I just had a question I picked up on page 10, a reference to the internal audit that gave an overall rating of reasonable. There were 2 matters relating to the financial position requiring it. I just wondered what those were, particularly given the escalated intervention around finance and planning. And my other question was, as ever, really, how confident are we of our integration and support with the Powys County Council Sustainable Powys? Because there's reference here to decisions yet to be made by the County Council in relation to that, which we know may have quite a material impact on our planning and our ability to deliver for the people of Powys.
Thanks, Nick.
Thank you, Simon. I think Pete may want to comment on the matters with relation to financial planning, so probably best for Pete to do that. With regards to the alignment with the local authority, we have the mechanisms through both our joint leadership team and the RPB executive team to make sure that our plans are aligned. Obviously, our strategic context is the same, so it is a health and care strategy, and that's the high-level objectives, our wellbeing objectives agreed through the area plan, and we take those forward through our IMTP as well. In terms of that detail, I'd like to give board assurance we're in really close conversation with the local authority about that impact of the choices they made, difficult choices they may need to make to balance their budget over the rest of this year. And we are actually actively engaged in their engagement activities around that. So executive colleagues, including myself, attending those sessions over the rest of this month as they talk to our communities about it as well. But it is something that we will need to make sure that we align with as our planning process takes forward now, particularly I would say between now and February, when the local authority may need to make those difficult choices through their formal mechanisms.
Pete, do you want to come in on the financial matter?
Yeah, happy to, Carl. So I guess it's quite easy to say simple, but harder to deliver. The simple reality is we need to devise that financial plan which allocates our resources, as has been alluded to, in the best possible way for the best outcomes for our population, and that needs to be within the funding resource available. Very challenging, but that's that's the ambition and that's the ask.
Simon, do you want to come back on anything?
What were the matters requiring attention, Pete?
Oh, sorry. It was management should ensure that future plans identify robust schemes to deliver the full annual savings requirement at the point of the MDS for Welsh Government, and management need to develop a robust and sustainable recovery plan in accordance with the Welsh Minister's guidance. So it's basically deliver a balanced plan.
Okay. All right. Thank you.
Yeah.
Thank you.
Yeah.
Thank you. Steve Elliott, please.
Thanks. Similar question to Simon, but in relation to primary care, and just if you could explain a bit, Nick, about how we make sure that we're engaging appropriately with primary care in the development of the plan. Thanks.
Nick, we've got one or two colleagues wants to come in, so perhaps we could take a couple of contributions and then invite you to respond afterwards. I can also see that Hayley wants to come in. Hayley, again, is it better for you to come in now, or do you want to come in later on?
It was really a comment around the point that had just been responded to, Carl, which is around the clearly in the point that Nicola raised around the board then considering our plan in March, and then the position we found ourselves this year without a supportable plan. Clearly, we'll be in active, more closer contact with Welsh Government from our targeted intervention status, and therefore I'm really keen to ensure that we collectively as a board with Welsh Government have that discussion about what a supportable plan means from the perspective of Welsh Government up front, recognising that there will be a balance here between pace, delivery and our ability to get through the necessary statutory processes to actually be able to submit a balanced plan overall. So I think it talks a little bit to the earlier conversation that we had about the money, targeted intervention, strategic cash support, but I'm really keen that Welsh Government alongside us now in the targeted intervention status, we're clearly able to get to a place where we may not get to a full balance position, I know that, but that there is agreement on the path that we're taking and the pace in which we're taking our route to sustainability going forward. Thanks.
Thank you, Hayley. So please, Nick, hold on to Steve's comment and question if you would, but let's also ask Mick to contribute. Thank you.
Thanks, Chair. I joined the board in March last year, just as the previous iteration of the plan was just about to be finalised, and I remember being struck by, the quality of the analysis of the challenge, the kind of structure and the priorities and the principles that underpin that I thought were really clear, and the vision that it kind of described of a different kind of future for healthcare and Powys was quite compelling, I thought. But when I read it, to use that overused kind of analogy of the roadmap, I didn't get a sense of what that journey was to that destination. It was more like, again, using the analogy as a set of directions to the railway station to get you off on that journey. And what was missing was the kind of key steps that would get us to that point. I know things have moved on now when we're developing the roadmap, but for me, that is a significant kind of development that needs to be in the next plan. It needs to describe that journey in a bit more detail and lay it out, what are the next steps that will take us on that route. So I'm just really looking for assurance that we are going to be in a position to develop that roadmap to the position where it can be published in that format, to give people a sense of, how do we get to that ambitious place in the future.
Thank you. So Nick, if you'd like to respond both to Steve and Mick, that would be helpful. Thank you.
Yes, thank you. On the primary care question, obviously there is a well-established planning process for cluster plans, which again, the health and care strategy is the overarching framework for that. So they align through the RPB exec and board. And as a planning team on the ground, we work really closely with the RPB team and the cluster leads to make sure they align, and it is really helpful that the health and care strategy and the overarching priorities make sure that everybody's pointing in the same direction. The question on the route map also intersects with that, which is really important. So the GPs, as we accelerate now the development of the route map, and Deb may want to comment on that, particularly through the test that we did on our temporary service changes. Our GPs are absolutely key stakeholders to any service change in Powys, because the way our services are configured, plus also their connection to our communities. So as we develop the route map, and particularly do the stakeholder analysis and develop the comms and engagement plan on that, GPs will be absolutely crucial, both to talk to, but also to listen and hear what they've got to say as we do that sort of go forward. So in terms of planning and the route map, a mixed question. I think having joined the health board, I can understand why Mick has had that reflection and asked that question. Now that the transformation team is fully in post, I know that work is accelerating, and my team and myself working really closely with the transformation team and Deb to make sure in that sustainability theme, which I talked about, the risk recovery and sustainability, that route map will be really visible. Now, it's not to say that there won't be further planning that we'll need to do as well in 25-26, and we will clearly lay out if there's further planning that we need to do, but we are working very closely together and very much at pace to make sure that route map is really visible and forms a really core part of our delivery plan in the plan. But I don't know if Deb wants to comment on that as well.
Thanks, Nick. Just to support what Nick has said, in terms of more visibility within this plan, what it won't have, because of risks of predetermination, it will have the sorts of areas that we're looking at. We've just joined some meetings with the council, 2 town councils, talking about the risks that we have by way of estate, workforce demand, all of that. So it's clear that they are some of the options that we're looking at. We are intending in 2025 to have further engagement sessions beyond town councils, in order to describe that to the public, listen to what the public say, and that allows us to go back and work on that case for change. So it's the case for change stage that we're at the moment, Mick, and we'll be making reference to that within the plan that Nick has described.
Steve, Mick, are you content, or would either of you like to respond to any of that?
No, thank you, that's
okay.
fine.
Thank you. So we come then to the recommendations in association with the integrated plan. It's quite a long composite recommendation, so I won't read every single word out. People have it in their papers, but we are asked to take assurance on the plan approach, and note also the current position and the theme of risk, recovery and sustainability. We're also asked to approve the strategic framework based on the refreshed PESTEL analysis. We are asked to approve the initial draft strategic priorities as the basis for the detailed planning and partnership alignment processes. And finally, we're asked to approve the planning maturity matrix in Appendix 3 for submission to Welsh Government as part of the escalation and intervention arrangements. Also, once again, we note that our PPPH committee has considered this, and as we heard in its report to us earlier in the meeting, this comes with its recommendation. Therefore, does anyone want to indicate, please, that they don't support the recommendation? So that is once again supported unanimously. Thank you. We come to the last item on our agenda. I'm always very conscious that this is always the last item, and I certainly don't ever want to give the impression that therefore it's the least important. In fact, that is certainly not the case. But it is the report of the Chief Officer, the Regional Director of Llais in Powys, and we've already acknowledged and indicated the importance of that working relationship, and indeed of Llais's role in taking forward a lot of the changes and the business that we've talked about today. So over to you, Katie. Thank you.
Diolch, Carl. I'm going to be quite brief, really, because I hope the report is fairly self-explanatory. Andrea wrote it for me. I was on annual leave, but she's put links into various reports that we've actually completed and undertaken. So just in summary, I thought board might be interested to know that last week we finished our intensive fortnight in both Hay and Talgarth, and we visited both separately rather than sort of keeping them as one. We visited both practices, for example, so we had coffee mornings in both towns, given their differences. We've got a public forum in Crickhowell on the 4th of December, which is next Wednesday, between 2 and 4. So if anybody is interested in attending that, then please do let me know. That gives the public an opportunity to come and talk to us about any issues that they might have with regard to health and social care, but also what we use it as part of our planning process about looking forward and what could be improved going forward. On that basis, we're currently looking at our priorities for 25-26, and this year we've captured some really important data and evidence through what we've heard at our various events and public fora, and just to let you know that as per earlier conversations in the board meeting, it's highly likely that neurodiversity will become one of our priorities for this year as well. So I'm sure there are opportunities where we can link together on that. I noticed in the Deputy Chair's report that she and you, Chair, I think, had visited Velindre Ward in Bronclease. We have recently as well. We visited the week before last. We took one of our advocates with us. We'd had a number of complaints that were going through our advocacy service, so we haven't yet had the feedback from that, but I understand it was a very positive visit. And I think just referencing, I know, Chris, a little while ago you mentioned about how we were getting on with social care. I think it's fair to say that social care is coming much more to the forefront now. It always was going to take a little bit of time, but we've now done 4 social care visits, for example, which might not seem like a lot, but I think from the point of view of what we're doing in Powys, we continue to sort of lead the way really across Wales on some of the work that we're doing. So that's all I was going to say, Chair. I'm happy to take any comments or questions from members. And as always, if anybody wants to pick anything up with me outside of this meeting or wants to share our contact details, then I'm very happy for them to do so.
Thank you, Katie. So, colleagues, any responses to Katie's report? Hayley, please.
Yeah, thank you, Katie. And, you know, it always, every time I see this report, how much you're getting out there into Powys in terms of your commitment to listening to patients and visiting across a number of different sites, including some care homes. It's just nice to see the really good mix of work that you're doing. For me, it's just the conversation, just some reassurance again about how we're picking up the insights which are in this report, but actually how that fits then within the committee work programmes to pick up thematically the issues that you're raising. And I know that we've strengthened those arrangements as well during this period as well, in terms of actually bringing that theme back in and triangulating the information that you're hearing with some of the other work. We talked earlier about patient experience, Civica, etc. So just just really valuable work, Carl, and in particular for me, it's just making sure that we're picking up in our overarching reports from other areas the particular insights that come from Llais and how we're responding to them. So just thank you very much for the report, really helpful.
Thank you. So nobody else indicating. So thank you from us all, Katie. Absolutely echo everything that Hayley has said, and yeah, we appreciate that working relationship going into the future as well. So thank you. So we come to the consent agenda. I won't repeat the explanation I gave earlier, and so those items under item 5, of which there are 4, we are asked to approve en bloc without decision. Does anybody want to indicate that they don't support doing that? So that is supported, and those 4 items under the consent agenda, the recommendations are therefore supported. Thank you. There is no any other business. We are next scheduled to meet as a board on the 29th of January next year. We will be meeting later today for our in-committee meeting, as referenced earlier, and therefore the last thing I need to do is to ask everyone if they would consider supporting the motion that enables the in-committee meeting to take place. And that is that the chair, with advice from the Director of Corporate Governance, has determined that the following items include confidential or commercially sensitive information which is not in the public interest to discuss in an open meeting at this time. The board is asked to take this advice into account when considering the following motion to exclude the public from this part of the meeting. And the motion is that representatives of the press and other members of the public shall be excluded from the remainder of this meeting, having regard to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest. Once again, does anyone want to indicate that they don't support that the adoption of that motion? Therefore, that is supported, and we will meet in the in-committee session in due course. Thank you very, very much to everyone who has prepared for today, contributed to the meeting, contributed to the discussions. Really helpful meeting as always, and noted and appreciated.